Okay, thanks. Hi, everyone. Welcome to, let's say, what is one of my favorite parts of Analytics for a Better World, because every year we have this amazing group of people coming together to work on data science from, let's say, around the world, working on different sectors, but all towards a particular goal, which is to do some good in the world with the kind of work we do, and also with using data science, which is another one of my passion. You all have been working very hard for several weeks now on your project, also in your learning journey, picking up new tools, picking up new technologies, working together with our mentors, but also learning from our trainers. It has been a very, very busy week, I can say, because I was seeing a lot of things happening in Slack, a lot of things. I have been also hearing some very positive things from the mentors. And I'm very glad that we are here today with so many fellows presenting their final project. We have around 3 hours, I think, blocked in the calendar, but hopefully we can make it fast. Please stick to the time that we have given to you in terms of presenting, and Irina will tell you more about the logistics of the whole thing. We'll have different breakout rooms and make sure that you are in the right room, because it can happen that your mentor and also your team members are joining to listen in. So, like I said, very, very exciting. But I want to start this day with a small session from Robert Monet, who is our managing director. He is going to talk a bit about analytics for a better world and how you can collaborate. And you have heard a lot about ABW already, but we just want to let you know that this is just one part of your journey, and we would like to continue working with you even after the fellowship is over, and hopefully join in your organization's mission to help the world become a much better place. With this, I'll hand over to Robert. Robert, over to you.
Thanks a lot, Parvati. So I'm very, very proud and happy to see all of you here. So I think today marks a milestone in your analytics journey. It is not just the completion of this fellowship, but also a new chapter filled with a lot of potential for analytics, a lot of purpose, and a lot of potential impact. And that is precisely what we aim to do with Analytics for a Better World. So it fills me with a lot of pride and a lot of inspiration to see everybody here. And I understood from Parvati, and I know this from the earlier fellowship, that there's a lot of hard work and a lot of effort to learn both the art and the science of analytics. As Parvati also mentioned, you have engaged in courses, in mentorship, both from our academic partners and from our industry partners. And you have been working on projects, which I'm very, very much looking forward to see. I cannot see all of them, so obviously I can just join one of the breakout rooms, but I will watch also the other two, because this is something that always brings me also a lot of personal excitement and inspiration, seeing what use cases there are all around the world for applying analytics, even the stuff that we have not been thinking of ourselves. So you have equipped yourself with the tools and the knowledge to harness this and to harness this potential. And with that, you are more or less the embodiment of our mission of Analytics for a Better World. Our institute is to unlock the value of analytics for people who make the world a better place. So with you, with all the skills that you now have, you are able to help other people make more impact. You can make more impact yourself. Your organizations can make more impact. So that is something that I would urge you and ask you to keep doing and applying these skills really into practice. And I think you are, with that, you are also more or less the living proof that analytics is not a technology or just a tool, but that it also has tremendous potential for social impact. And I just hope that you are that you keep on pushing that. But also, obviously, what you have probably also learned when gathering data or working with stakeholders or any challenge that comes up during these kind of projects. Challenges will come also after this fellowship. So this is never it's never a smooth run projects like these. So that is very normal. Just be prepared for it, and know that if you are running into these kind of challenges, we are also very happy to help you and happy to support you. So I want to invite you to reach out to us whenever you find a challenge. We are here to support. We are eager to collaborate and help you make these efforts lead to meaningful outcomes. For that, we have a few opportunities for you. So one of which is, and that is still not fully out in the open because we're also still designing it, but we have the ambition to launch an accelerator program next year. Which is aimed at helping a select group of nonprofits to grow their analytics maturity in a very big step in 1 year time. So this program will offer ideation sessions, project scoping sessions, community building, leadership training, and hands-on collaboration to tackle analytics cases together. So you have all been in this fellowship. This fellowship is more or less an individual encounter where you do a small project in a few weeks. This accelerator program will run for a whole year, and we will work in larger teams together on larger projects, and we will train a few people from the leadership of the nonprofits. We will train a group of hands-on specialists to make an even larger impact than we are able to do with individually. So this is also a very large peer-to-peer and collaborative effort to create more impact, basically, with analytics. The second opportunity that you have, we organize many events. We are always we are active online, obviously. So we have a website, a LinkedIn, and we have a monthly ABW cafe and a yearly conference. This is a place where we share our own knowledge, where we invite you to share your knowledge with each other. So please follow us. Join our newsletter. We will send this information to you after, maybe you have already, or we will get that information to all of the fellows. Thirdly, the fellowship Slack community will stay open, so you will have the opportunity there to keep engaging with your fellows, with your fellow fellows, to share knowledge and to ask questions. We will also be in there, so if there is anything, just shoot us a message. And then at last, if you encounter an analytics challenge that you cannot solve by yourself, that you require additional support, or you have a big idea where analytics can have a major impact, don't hesitate to contact us. So we can explore funding opportunities together. And collaborate on the solutions that will drive impact. You can reach out to me, so my contact details are on the website, but you also know how to find Irina and Parvati probably until now, so they can also connect you with me if you want. Well, then those are the opportunities, and I want to wish you just something more after this whole journey. So I want you to encourage to keep learning. So obviously, what you have learned in this fellowship is a big step, but it's also just a start. So stay connected with your fellows and keep doing what you do to apply analytics for a better world. I want you to thank you for your passion and your contribution to this fellowship. Together, let's unlock the value of the potential of analytics for people who make the world a better place. And I'm really much looking forward to the projects that you are about to share.
Thanks a lot, Robert, for that. So today, as you know, we are celebrating all your graduation and going to see all the exciting work you have been doing. But there is another reason for us as a team to also celebrate at Analytics for a Better World. You have already met Robert, you have met me, Irina, Professor Joachim, Britt, all throughout this whole journey at different points. But we have a new colleague who have joined us, Tessa. So I would like her also to introduce herself to you, and as we look for more collaborations from all of you, you probably will also be contacting her at some point. Tessa, over to you. We cannot hear you, Tessa.
Is this better now? Can you hear me now?
Yes.
Okay, good. Hello, everybody. I'm very honored to be part of this team that aims to make the world a better place. I have a couple of minutes to introduce myself. I think I don't see. Oh yeah, there we go. They say that picture says more than 1,000 words, so I put a couple of pictures together of me and who I am. I'm Dutch, but I was raised in the UK, and to be honest, I feel the most at home in an international environment, and so I was in a number of different times in my background. I actually came in contact with analytics and operations research and process optimization for the first time in my time with TNT, where I also worked together with Ortec, who is obviously a partner for the Analytics for a Better World. And I think the things that for me are the most important and the things that have always driven me in my career are digitization, diversity and sustainability. So I'm super happy to be here and to be part of your team, and really looking forward to an inspiring afternoon and learning about all the projects that you've been doing. And for you, this is the closing of the fellowship, but I hope that this is part of a new journey for us together. And just like Parvati said, I hope to keep in contact with you going forward. Thank you.
Thanks a lot, Tessa. So with this, I think I will very quickly tell you the agenda for today and then hand over to Arina for logistics and also for her to tell us a bit more on how the breakout rooms will work. So like you heard already, we had a few welcoming remarks from our team. You'll be divided into 3 breakout rooms. The schedules for the breakout rooms have already been shared with the fellows, but while teams are being divided into breakout rooms, I'll also flash it on the screen so that you know in which room your colleague or mentor is going to, or your mentee is going to be presenting. And then we'll have a short break, and when you come back, we'll hear from you some highlights or things that you heard in the breakout room which inspired you or which triggered you into using data in a different way. And then, of course, we'll be joined by Professor Dick, who is our Science to Impact co-director. So this is an overview agenda for today. And now I'll
are fine. I will give the word to our first fellow to present their project. Whenever you feel ready, you can start sharing screen and presenting it.
Please confirm if you can see my screen.
Yes, all good.
All good.
Okay. Good morning, good afternoon, good evening, everyone, wherever you are. My name is Brian Twesige. I work for the AIDS Support Organization, Uganda, commonly known as TASO. I am excited about this opportunity to present to you on malaria case management and commodity consumption tracking, and where we shall unveil some gaps, as you will see. My analysis was drawn on data that is reported in the National Electronic Health Management Information System, and covering 4,416 health facilities. These are basically public and private not-for-profit facilities, and for the period January to September 2024. I will show you an overview of the data set that I was analyzing that had the region, the district, stroke city, health facility, the malaria cases that were treated during that period, and the consumed doses of malaria treatment, including the ratio consumed to treated, and also the reporting status for each of these facilities over that period of time. And my aim was to understand the relationship between the treated malaria cases and the consumed doses of antimalarials, that is for the treatment. And surprisingly, there were some disturbing trends, which you will see along the way. And first and foremost, we'll appreciate that from the analysis, there was no correlation between malaria cases treated and the doses that were consumed. As you look at the correlation level at 0.051, this didn't show a good picture, and it was further complicated by a finding whereby over 87% of the reported ACT or anti-malaria treatment data that was seemingly inaccurate, as you may see, underreporting at 27%, over-reporting at 60%. And this is quite glaring, and it raises a number of concerns about the data that is reported and utilized. It raises concerns about issues of commodity management, supply chain management issues, including reporting. And with this picture of significant, if you like, inaccurate reporting, I was interested in looking at highlighting a few facilities. But before I go to those facilities, this graph and the previous one of the correlation heat map were generated using Python. This is a skill I picked from the fellowship. When we come to the 10 facilities that I prioritized, that the most problematic ones, I had to map them just as you see. And they are mostly in the lower half of the country. And when you look at the ratios, these are extremely high. They are double, triple figures. And these still show that there must be something significant that is explaining or that is behind this figure or this view that we are seeing. I would be quick to mention that this map was generated using QGIS, and I appreciate my mentor who had some technical input when I got stuck with finding the coordinates, but she was very supportive in helping me at least come up with the coordinates that I couldn't easily find. And as far as this excessive reporting is concerned, I believe there is need to find ways of improving on data accuracy and also optimizing the utilization of the antimalarials. And this is one of the things that there is a list that you're seeing that I think should be in position to address some of the glaring gaps that may be behind these findings, and where we shall have a comprehensive data quality audit that will look into these discrepancies to establish the root cause of these issues. Also conduct or investigate the stock management and supply chain issues to be sure that commodities are well distributed and reported on accurately. And also a look into the access of malaria diagnosis accuracy to be able to know that all facilities are actually handling malaria cases according to the national approved test and treat guidelines, and also look into the supervision and conduct supervision and regular monitoring. And in this, we'll be in position to have that oversight that will contribute to accountability and accurate reporting. And with this, I am sure that with proper utilization, with improved data accuracy and optimization of anti-malarial utilization, we shall ensure that the limited resources are effectively utilized to be able to reduce, contribute to the reduction of the malaria prevalence in the country of Uganda. Thank you so much. Thank you for
Thank you so
listening.
much, Brian. Thank you so much. Now, because we're a bit short on time, we invite David to present his project. Welcome, David.
Welcome. Thank you. Give me a minute. Let me set myself up. Greetings, everybody. My name is David Vella, and I undertook this project for the National Blood Transfusion Service. We're the only licensed blood establishment on the Maltese Islands. My aim was to utilize AI to continue guaranteeing blood supply sustainability. For context, one of our major issues is frequent shortages due to poor donor retention. So my aim was to visualize the relationship between donor attributes and their impact on whether a donor is being lost or retained, and to build a model predicting whether a donor is lost or retained based on these pre-existing attributes. On the right, this is the algorithm I use to construct the target variable for supervised learning, donor status with two outcomes, donor lost and donor retained. I used Excel for data collection, and I used R for constructing the target variable. And here you have a list of packages I used
Sorry,
for the
David,
rest of the manipulations.
excuse me, we
Anyways.
still see the first slide. Yeah.
Give me a minute, sorry about this. How's it now?
Yeah, we see the next one.
Yeah,
Are you
now you're
all right?
switching.
All right.
Yeah.
I see, because I put it on presentation mode. Okay. So this is the algorithm I used to build the target variable with two outcomes: donor lost and donor retained. Database. For the project, I used all attempted donations at our blood donation center from the first day of 2022 till the last day of 2023. I downloaded them from our eProgisa system. In white, you have the list of the donor attribute variables, and the constructed target variable built from the attribute variables is in orange. So to visualize the most influential donor attribute variables, I used principal component analysis and supervised learning. It turned out that deferral frequency had the strongest impact on donor status. This was followed by donation retention, donation frequency, and age. Random forest variable importance plot more or less corroborated what the PCA showed. Basically, donation frequency and age were the most influential when it came to model accuracy. I did a random forest model of the entire data set, and unfortunately, it did not perform satisfactorily. There was high accuracy with the training data sets, but unfortunately, the random forest model was very bad at identifying retained donors in the test data sets. The kappa value also showed that there was very poor corroboration between the predicted outcome and the actual outcome. So basically, the model was overfitting in the training set and basically guessing in the test set. This was primarily because of the very high number of lost donors compared to retained donors, which created significant imbalance. So to address this, I used random oversampling examples. The Rose model had an overall better performance than the random forest, but the kappa value was still not adequate, and neither was the balanced accuracy. So to completely offset the imbalance, I created a manually balanced subset from the original data set with an equivalent lost to retained donor lost to donor retained ratio, and I used ensemble. The ensemble model had a lower overall accuracy, slightly lower overall accuracy compared to the previous models, but it was better at correctly identifying true lost and true retained donors compared to the other two. And the kappa value showed moderate corroboration between the predicted outcome and the actual outcome. So this, out of all the models used, this was the one with the best performance. Limitations. Class imbalance was the cardinal one. Consider a large number of lost donors compared to retained donors biased the sample, and it made predicting lost donors far easier than identifying retained ones. The model was heavily dependent on selective variables, making it vulnerable to noise, and there was significant overfitting of the training data. Future improvements to have better results would include widening the time frame, adding more variables, hyperparameter tuning, and using more advanced modeling such as GBM. Finally, I would like to thank my mentor, Martin, who helped me quite a lot on this project, and I would like to thank our IT team for providing me with the data. Okay.
Thanks a lot. Are there any questions from the group?
Everyone, good morning. For those that might have a different time zone, I'm called Irina Yanga, and I work with Amref Health Africa in Uganda. I'm presenting a dashboard for sexual gender-based violence cases. This is across a program called Heroes Program within Amref that looks at supports nine districts, cyberden districts in Eastern region. There are 8 districts in Eastern region and then 1 in Central Uganda. So my presentation outline, sorry, let me see if I can make. Are you able to see my screen?
Yes.
Okay. So my presentation is about a dashboard for sexual gender-based violence cases across 9 districts, 8 in Eastern Uganda and 1 in Central Uganda, as you will see as we proceed. So my presentation is basically introduction, goals and objectives, the methodology I used, and then the brief on the results, and then a conclusion. So this is a preamble really about sexual gender-based violence. It's a significant problem that is affecting a lot in Uganda, specifically in the Eastern region, where we are working. And so with all the complications and the issues that come along with SGBV, so the essence is really to have effective data collection and analysis and utilization, such that we can make evidence-based interventions and support advocate for better policies as well. So the goal and objective was to develop the dashboard that will improve tracking and documentation of SGBV cases. This is both in the health facilities and advice centers. The advice centers are like one-stop centers where we provide GBV services. They are found in the communities within those 9 supported districts, like I mentioned, 1 in each of the districts. So basically, the objective was to enhance SGBV data analysis utilization in the supported facilities, and then to develop the dashboard. So the methodology, I downloaded data from two systems. One is the District Health Information System, DHIS2. This is a national Uganda system where data on many of the indicators that are health related is reported. And then we also have one for the program, the HEROES program, the STBV program that we collect from the communities. So the data was then the data from the two systems was put into Excel and it was cleaned, and then I merged it using Microsoft Excel. So the data was merged and then I exported it to Power BI. So that's where I developed the visuals and came up with a final dashboard. So we reviewed with my mentor and made some adjustments. Thereafter, we're able to come up with a dashboard, and this basically tells us about where the cases are prevalent, which district has the highest, and which periods. We realized that because we've done some work in those districts, where when we compare where we started, the reporting of cases has been increasing because we looked at a trend of the last 3 years, that is 2021 to 2023. So as you'll see below, in 2023, the cases have been increasing, and Iganga had reported the most cases, and the most common STBV category was the economical, because there's a lot of poverty in these areas, but as much as also sexual violence was really high in the areas. As we are aware, many of these young girls really drop out of school early and really engage into sexual activities quite early. So as you can see, this is a brief of the dashboard. Basically here, I would look at the trend for the years, and also you'll be able to select by district to know how each district is performing. But basically from the cases, we said Iganga had the highest, had reported the highest, and then the category, we had economical violence appearing most prevalently. But as well, we also had other significant categories of STBV, like physical, sexual, and all that. And then this is a map. You could also be able to look at the location of the actual districts to know what is happening. And then these are the total cases by period for us to look at the picture for. Receive health services, and they've also been provided with psychosocial support. We've had some mediation and resettlement, and also supporting legally to represent and support them get justice for some of the reported cases that needed that. So basically, you can be able to access my dashboard on this. I don't know if the time allows, and I quickly go there. I don't know if that's in order to quickly go there, or that's fine, but that's how it looks like really. So that is it basically. But if we want to empower the people at the district facilities and advice centers to really be able to as expected, such that we are able to address critical issues and support to make significant impacts, and maybe this data really. That is what I had. Thank you.
Can I ask a question?
Yes, someone is speaking.
Yes, that's me here.
Yes, please.
All
I would
right.
also want to thank my mentor, Jos Van. He really supported me, I think, with the coordinates, mapping, and all that. We really worked together on that. He was very supportive. And I also want to thank the organizers of the fellowship for giving me this opportunity. Thank you very much.
Alinette, I think you can start sharing and start the presentation if you want.
Hello, everyone. I believe that I'm audible. Can everybody see my screen kindly?
Yes, at least I can see it.
Yes.
Okay, my name is Lynette Rono. I am a clinical and business analyst at Metropolitan Hospital, Nairobi, which primarily operates under the Metro Group Foundation, as you can see on my logo. And my project mainly was about diabetes risk prediction. That's actually a prototype for which forms a basis for a more intensive telemedicine platform that's going to integrate multiple chronic illnesses in the future. Okay, so for project background and objective, diabetes is a chronic metabolic disorder characterized by elevated blood glucose levels. So the main indicator of diabetes is actually elevated blood glucose levels. And given the increasing prevalence of diabetes, early identification of the risk individuals is crucial for timely intervention. This model serves as a foundation for a telemedicine platform focused on early chronic illness detection. And other chronic illnesses that I'll focus in the future are arthritis, asthma, epilepsy. Yeah, you can name a few. And the objective of this project was to develop a prediction model that assesses the patient risk of developing diabetes based on their specific health metrics. And for my data set, I had around 7 features that I focused on. That was age, gender, BMI, the body, BMI, blood pressure from systolic and diastolic, temperature, respiratory rate, and pulse rate. How does this project focus and contribute to sustainable development goals? Give me a second. First, it focuses on 3 SDGs, namely good health and well-being. This is by predicting diabetes risk early. Healthcare providers can initiate timely interventions, reducing the risk of severe complications and enhancing overall community health. The second SDG in focus is industry, innovation, and infrastructure, SDG 9. The project's use of advanced data science techniques encourages innovation in healthcare technology, laying a groundwork for scalable data-driven healthcare solutions. And lastly, number 10, reduced inequalities, emphasizing equitable access to preventive healthcare through innovative technology. The business questions for my project. Can we accurately predict diabetes likelihood based on healthcare metrics? Which features are most predictive of diabetes? How accurate is the model across different demographic groups? And what additional parameters can improve the model's accuracy? All these questions I will answer as the slides progress. Data understanding, I had 32,779 patient records from the database, and my source was mainly the hospital database, the screenings that we do free, and also the outreaches that we conduct as the foundation. The key parameters, as I had mentioned, are age, gender, weight, height, blood pressure, pulse, respiratory rate, and also I had a column on pre-existing condition. This pre-existing condition column was majorly because there are some indicators of diabetes like high blood pressure, which would of course make the target column have a high risk, and could classify either low risk, high risk, or medium risk. So from my data set, whoever had hypertension was most probably went to the high risk of diabetes. The data exploration and cleaning. For data cleaning, I addressed missing values and detected outliers. I did feature engineering to enhance the analysis of the model. I created age group, feature, BMI category, blood pressure category. Diabetes is hypertensive, and a target column of diabetes risk, which I classified into 3 classes: high risk, low risk, and medium risk. For exploratory data analysis, the data is mostly normally distributed. That is what I found out. The outliers are expected since it's a hospital database where my data mainly streams from. And we, of course, have patients who come in with extreme conditions. Records with patients with diabetes diagnosis were dropped to ensure the model predicts previously unconfirmed diabetes patients. So I dropped everyone that had come in and diagnosed as diabetes because I needed the model to train on unknown diabetes cases. This graph generally shows an overview of the data distribution of my dataset. As you can see that my dataset had more females than males. As per BMI, I had mostly overweight data entries, then followed by normal, then obese class 1. For the feature age group, majority of my dataset were ages 36 to 45, then followed by 46 to 55. As per blood pressure category, most of the dataset, the data entries were normal and high and then low. And is hypertensive, most of them did not have hypertension. I'm sorry for that. This also shows the distribution of my dataset. I used histogram plots versus the box plot. For histogram plots, this shows a distribution of pulse rates per count of patient records, and against the outliers, this is the median range, and these are the outliers below the quartile and above the quartile. Same thing for temperature. Okay, this is where I got a distribution of my target column diabetes risk and found out that medium risk was the minority class at 0.8%. Low risk was a lot, like the higher percentage at 80 and high risk at 18%. So this is clearly it's an imbalanced data set with medium risk being the minority class. For modeling, I did a data preprocessing, categorical encoding. I did a train test split at 80-20%. And for my class imbalancing, I used SMOT. For models, I used random forest, logistic regression, and XGBoost. And then I used the evaluation metrics of accuracy, precision, recall, and F1 scope, and I'll show you how the models performed. And then I ended up choosing XGBoost, and I fine-tuned it, and I did a feature importance lastly. For the model performance, random forest had an accuracy of 99.39%. Logistic regression had an accuracy of 93. XGBoost classified an accuracy of 99.46. With random forest, it perfectly could predict all low-risk classes, and out of all the low-risk classes, it could correctly identify the classes at 99%, and the F1 score is a balance between the two. For medium risk, which was my minority class, random forest had an 88% predicting. Out of all the medium classes that it predicted, 93%, it could identify 93% correctly. And for high risk, it predicted 98% of high risk class and could accurately identify high risk at 99%. For logistic regression, it did not perform well for the minority class, where it could predict 22%, and out of the 22%, it would identify 95% accurately, hence a low F1 score. And XGBoost, basically, it worked best because for low risk, it could identify perfectly. It could also identify correctly, perfectly, and the F1 score was perfect. Same case for medium risk, it was at 91% compared to random forest at 88 and logistic, which was low at 22. And for high risk, it could also identify at 99% correctly of all the high risk classes that the model predicted. This is a model summary for my...
I think Irina said in the chat that your time is kind of up, so she wanted to invite the next fellow. maybe you can just share the findings, or like just wrap up a bit.
Okay, for my feature importance, as you can see for XGBoost model, the feature that can influence the most when predicting diabetes was blood pressure, and then followed by age, and then hypertension. These were the least importance for XGBoost model. My recommendations and future work, I would further do an hyperparameter tuning and increase the weight for medium risk. And my long-term visions and partnerships would be to extend the model to predict other chronic conditions, to scale the prototype into a mobile development app for accessibility for underserved populations. I would partner with other hospitals to integrate the model into an existing platform for remote monitoring. And finally, I would work with AI and technology companies to refine the model and collaborate with manufacturer companies for successful integration into wearable health devices. Those were my findings, and these are my long-term visions.
Nicely, Ned. Thank you. I think very useful, especially since diabetes is such an issue, I think.
Okay, thank you.
Can you maybe stop sharing, or maybe I can try and share?
Let me stop sharing.
Okay. Can everyone see my screen? My PowerPoint presentation?
Yes.
Okay, let's see if
Not
presenter
in
mode
presenter
works for
mode.
me. No, let's see if that works. Okay, hello everyone. Yeah, so I'm Madeleine. I'm working for Doctors Without Borders.
Madeleine?
And maybe, yeah?
It stays in the normal one. Maybe try the book next to the presenter mode down
This
in the
one?
screen. Yes.
Okay,
Yeah.
let's see if this works. Okay, hello. I'm working for Doctors Without Borders, Médecins Sans Frontières, and what we do, you probably all know, but very quick, one sentence. We bring medical humanitarian assistance to victims of conflicts, natural disasters, epidemics, or healthcare exclusion, basically where we are needed the most. My project for the fellowship was improving what we call the cold chain item management process, and I will get to what exactly that is in a bit. But not before I thank my mentor, Tim Walter, who helped me majorly, and I want to thank him for his support. Yes, the cold chain process. So cold chain products, cold chain items are items that need to be stored and transported within certain temperature boundaries. So they can never get below either 2 degrees Celsius or above 8 degrees Celsius. So for example, when we ship a truck with a hepatitis vaccine from our warehouse to a hospital, the sun is shining, it's burning down. And at the hospital, the cold chain responsible person may notice that there has been a violation of the temperature regulations. So the temperature of the vaccine has risen above 8 degrees during the transport. When they notice this, they fill in what we call an excursion report. So they fill in an Excel file that they send to the office in Amsterdam, the MSF office in Amsterdam, and here either a lab advisor, a pharma advisor, or both, depending on what kind of products are in the excursion report, have a look and see if the excursion was bad enough, basically, for the item to have to be discarded, or if we can actually still use it if the excursion was not too bad. And this they email back their advice. They email this back to the cold chain responsible, and then the cold chain responsible can act accordingly. However, this is the ideal situation. So there may be also some back and forth between the Amsterdam office and the cold chain responsible for clarifying unclear data, incomplete entries, incorrect entries. So it might be quite tedious, which is exactly what my problem is, or what the problem is. The communication between Amsterdam office and the field is tedious, while for a great number of items, actually the decision whether or not to clear for use is quite straightforward. So what we wanted to do was build a prediction model that indicates whether or not a certain item can be cleared for use based on the previous decisions. And the impact this will have is that it will save time and money for both field practitioners who don't have to fill in those excursions and they still have to submit the data, but they don't have to wait for the office advisor to get back to them. Also, the office advisor is actually giving the same advice over and over, even like not necessarily, might not be necessary. The velocity of operations, a decision can be clear like immediately. So the cold chain responsible can stand in front of the fridge, can get a decision immediately, and then use the product or throw it out. And lastly, I think as when the purpose of reporting becomes more clear and it's more easy to create reports to report the excursions, this leads to improved willingness to report and more accurate reports also. Yeah, so the prediction model, it will be a decision tree. We're focusing on 15 specific products, of which the Hep B vaccine that I already talked about is an example. The features, there's 3 features: the status of the freeze tag, so whether or not an item has frozen; the status of the vaccine vial monitors, which are only present for some vaccines, which indicates whether it has been exposed to excessive heat and if that has diminished the quality of the vaccine; and the magnitude and the duration of the excursion. And this will result in a target variable advice: either discard the item, seek advice from the Amsterdam office if the case is a bit more complex, or clear for use. In the decision process, advisors will generally first have a look at the freeze tag and the VVM status, and then they will look at the magnitude of the excursion. But a certain value for a certain feature doesn't always have the same outcome. So it's really specific also for certain products. For example, freeze tag being an alarm for the blood grouping test, it's not a problem. But for the Hep B vaccine, it gets discarded immediately. Data cleaning, I had to discard about 25% of my rows because either the minimum temperature that was filled in was higher than the maximum temperature that was reported, which of course doesn't make sense, or they were either both empty or one of them was empty. Also, sometimes there were invalid date formats, which prevented us from establishing how long the item had actually been out of like outside these temperature boundaries. Or there is an invalid entry for the vaccine vial monitoring status. And some of the lines had more than one removal condition applying to them even. Then I wanted to share with you some of my successes and struggles. As you, maybe I already noticed by now, one of the struggles was that I didn't create the model yet. But of course, there were also some successes because the stakeholders' input and enthusiasm was really nice, really thinking along. Also, I was mentored towards a very clear approach how to tackle this problem. I had a lot of opportunities for learning because this was the first time doing this. And above all, the applicability, the scalability, and the impact of the final product, if we will be actually able to bring something like this to production, will be huge. But of course, there's always some struggles, such as data quality and data cleaning. I think we're probably all struggling with that. Then for next steps, building and evaluating the prediction model. I did already create a version, but I didn't have time before handing in the presentation to properly evaluate. Also, we need to involve prospective end users in the field to guide further development. And lastly, review the current data entry tool and/or processes to improve the data quality. And if there's any questions, please let me know. Otherwise, thanks a lot for listening to my presentation. I'll see the chat. Sophie, I think I need to hand over to you because it's time. So good luck.
Thank you. Thank you. I'll share my screen 1 second. This is different than the Teams I'm used to. Okay. Do you all see my screen?
Yes.
Perfect. Well, I'm Sophie Jacobs. I'm also from Doctors Without Borders, and you've heard from Madeleine already what we're doing. So I'm going to tell you a little bit more about the Staff Health Anticipation Project, which I've been doing in the last few weeks together with my mentor, Bas Verhoef. Okay, yes. So a little bit about a roadmap. First, I spent quite some time on formulating the problem. Then I also started spent quite a lot of time on the pre-processing of data because the data quality wasn't quite good. But I'm not gonna talk more about that. Then I explored my data and did some predictive analyses. So first, problem formulation. So at Doctors Without Borders, there is a lot of international staff, and before they go to an assignment, they always do a kind of health check. So there's a survey before they go, where they monitor physical and mental health, and when they come back, they do such survey again. So what we'd like to predict is to see, based on the pre-mission data we've got, if someone's likely to get a depression or worse depression symptoms during the mission, so that during the mission we can actually give them some extra support. So this is the first finding. This is about how big my sample is. It looked like I had quite a lot of data, but then I looked into it and there's a lot of T1 data here in blue and a lot of T2 data, but there's only a little group overlapping. So there's only a group of 151 people who did both the pre-assignment questionnaire and the post-assignment questionnaire, and I needed that group to do my analysis. So that's quite a small group. Then I looked into the following. So in previous research, 4 kind of groups were found regarding the trajectory of depression. So there was a group who at T1 had a low depression score, and at T2, after the mission, still a low depression score. Then there's a group who had a high score depression score at T1 and also a high one at T2. So they were ill at the start and stayed ill. There's also a group which were not depressed at T1, but became depressed after the mission. And the other way around, people who were quite depressed at like before they did the assignment, but then went on the assignment and came back less depressed. So I wanted to see if that kind of trajectories I could also find in my sample, and you see quite a nice distribution of them. I wanted to focus on the worsened health because that's the group where we can give some extra support during the mission to make them not increase in depression score so much. So what I did first is look into correlations of my features with the increase in depression. And I saw that marital status, gender, and meaningfulness, which is a sub-questionnaire about the meaning in life, that those 3 features were all correlated with an increased depression. So I wanted to take them into account for my predictive model. So this is probably not readable, and that's fine because I just wanted to show you the concept of the decision tree. So I wanted to see how I could label someone as being in the healthy trajectory, worsened trajectory, improved or depressed based on the T1 data. So here you see that there's the full training set, and then at every node, it looks at what variable can split the group best in the different trajectories. And this is done until you get the purest kind of groups. So this is the training set. Then I looked, okay, but actually is this model doing it well? So what are the predictive features and what is the prediction accuracy? So I looked, and there's two features which are important. However, only depression at T1 is significant. Then I also looked at accuracy, and for this presentation, I focused on the worsened trajectory, and you see that the recall is very low, meaning there's a lot of false negatives, meaning we would miss out on a lot of people who actually needed help during the mission. And this could also be due to a very low N, because this is, of course, the test data set, which is just 20% of the full data set, which was already quite small. So to answer, can we predict if someone is likely to fit in the trajectory, worsen depression based on T1 data? With this model, no, unfortunately not. So I also want to share some successes and challenges. First success, I worked a lot with Python, which I really enjoyed. I've only done analyses like these in R, and it's been quite some years ago. And I learned a lot from my mentor as well. Thank you. We focused a lot on problem formulation. I found that really hard to really scope down and keep on asking questions. And he did a code review, which I'm learning a lot from. Then some challenges. I found it hard to define a small and clear goal. As I said, the data quality was really poor, and I had a very small N. So yeah, that was pretty challenging, but overall it was really nice. That was my my project. So if anyone has any questions, let me know, and otherwise we'll go further to the next person. Suzanne, I think it's your turn.
Hello.
Hi.
Oh, okay. I hope everyone is seeing my screen.
Yes.
All right. Let me minimize this. So Susan Nachidodo is my name, and I work with Amref Health Africa in Uganda. So my project is about developing a dashboard for curriculum-based sessions for enhanced data use at the district, but also at the sub-county levels where we're working. So a brief overview of the project. Currently, the organization, we're implementing these curricular-based sessions in communities where these sessions are for providing sexual reproductive health and rights information to different groups of people and also to the different age groups. So we have these sessions as facilitated by peers that are working in the community, and then they are being supervised by community-based organizations that were subcontracted on our behalf. So these sessions are carried out in different communities and also depending on the different age categories. So we have like 5 curriculars: family health, men engage, program-wise, Synovio, Journeys Plus. And currently, we were not using a dashboard to see which areas need more support, which areas are performing, which curricula is performing. Hence, I came up with a project to develop a dashboard so that we are able to know where to target more of our interventions, which people are not receiving information, and that's where we shall be targeting. So this information is collected by the peers who document it on the paper-based registers, then later submitted to the CBOs or community-based organizations that supervise them. And then these CBOs find data entrants who enter this data into the different tablets using a survey CTO app. And that's how the organization were able to receive this information from the CBOs. So, so my aim was we need to use a dashboard so that we are able to see which areas need interventions the most. Then also which curriculums are not performing well, given that we have different targets for the curriculums and for the sub-counties. So we needed to find out which areas are not performing well. So with the dashboard, it enables us focus our interventions in areas where we are not performing. So I don't know. So this is the screenshot of the dashboard. Don't know. Oh, yes. So this is a screenshot of the dashboard. It shows the different sub-counties where we are working, and then the targets, how many people have we enrolled, how many are still ongoing, given that these curriculums are different. They have different sessions from session 1, depending on the curriculum. And then those that have completed the sessions, so we get to find out how percentage enrollment and then percentage completion, depending on the district, and then the different sub-counties, but also the different curriculum. Also, I needed to know which people, which sex is being reached the most. Are they the females or the males? So I continued, and from the dashboard, I can see that majority of the females were reached, and some males, of course, were reached, and of course, the highest age category that were reached were the between less than 15 years of age. Yeah, thank you so much. Sorry, I'm supposed to continue share. Sorry, I've removed. Hello? Is anyone there?
Yes.
Yeah, we can hear you. No worries.
Oh,
We've seen your
okay.
presentation. It was really nice. Thanks.
Oh, okay. Okay. I thought
Yeah, you don't have
hadn't.
to do it all over
All
again.
right. All right.
Yeah,
Okay.
it looks
Thank
lovely,
you
the
so
dashboard.
much.
Thank you.
Yeah.
Thanks.
And thanks to my supervisor, to my mentor, Erico Santos, for the support. Thank you so much.
Thank you, Suzanne. And I will share my screen. Are you able to see it now?
Yep.
Okay. Yes. Okay. Let me make it a bit bigger. The title of my project is The Insights into the Impact of Multifaceted Cash Transfers that 100 Weeks is doing. What 100 Weeks is the organization I work for, and what is 100 Weeks? 100 Weeks, it has the aim to get people out of poverty. And we're doing that by 3 things, a combination of 3 things. We give weekly cash transfers to women, especially living in poverty, and we send them cash transfers of €8 per week. Besides that, we organize weekly trainings in groups of 20 people. The beneficiaries come together and they get the training in financial literacy, entrepreneurial skills, life skills, stuff like that. Creating a business ideas, basically on what to do with those weekly cash transfers they receive. And on top of that, they get weekly VSLA meetings. So that means they come together in a savings group where they can save some money, the money they receive or other money. And the end goal is within 100 weeks, we hope that people have the tools and also skills to create their own businesses and get themselves and stay out of poverty as well. So what are my research questions? The first question is how to measure success. So how do we how do we measure that we make impact? So is the program that we have indeed, does it have the results that we want to? Secondly, what determines success? Are there any things that we can change, maybe when selecting people, or other things that we can change that we can make our program more successful? And thirdly, what drives success? So what is the pathway out of poverty, basically? This is the overview of our data collection, that we collect quite some data along the program. So we have a program of 100 weeks, and here you can see at which moments we collect data. So we have a baseline and an endline interview, which takes about 45 minutes, and then during the 100 weeks we have 3 phone surveys, where we ask part of the full baseline and endline survey. In addition, we also have a survey 1 year and 2 years after the program. So the first question was how to measure success. Now, it's not something that I did new, especially for this project, because we already try to measure success. And we do that with the multidimensional poverty index, which measures poverty levels based on health, education, and standard of living. And in the data we have made the calculations. We had them already, but we did it in Tableau. And what I did for this project is I converted them into Python, into Google Colab. So that was new for me. And that was also very useful for us to have those calculations in Python, because in Python we can see if there are any correlations between the MPI scores and other features of the program, basically. So my next questions are, okay, the MPI is now in Python in Google Colab. And an overview of that MPI data is in this graph. And what we are interested in is who are these people that get out of poverty and stay out of poverty also 1 year after the program. So that's the question, what determines success, and how do they get there, and how do they stay there? And that gets to the second question of my project. Next slide. So what determines success? To discover that, I did a linear regression analysis, and I looked at several characteristics, basically baseline demographics. So which country do the people live? What age do they have? What's their household size? Those are examples of things that we thought in advance, maybe people that have a big household size or are younger maybe are more successful, and the chances are bigger that they get out of poverty. So I've played with it a bit around, and I found that none of these things can predict whether a person gets out of poverty in the end. Only education level had a small correlation, but not in general. The conclusion was that there was just no demographic that could predict success, which of course is also an interesting finding, because it means it makes sense that the pathway out of poverty is not straightforward for everyone. So that was good to understand. So the second question, what drives success? And because it's panel data and it's not only data collected at one point, I needed to use a different method, and which is what was the fixed effects regression analysis. Unfortunately, I did not get any results yet, because I did get all types of errors which I couldn't solve before today. But my plan is to look into that further and see if, for example, nutritional status, education, or how much they save along the program, can understand us better, how the people get out of poverty. As an extra thing we have on the question what determines success, you have the MPI score, as I just explained, but we also have our own ABC success rating. So I was looking at if the ABC success rating correlates with the MPI, because the ABC rating we created ourselves, and to understand if it really has an added value and if it really says something about poverty, I looked at the correlation between the MPI and the ABC rating. And in addition, I did an ANOVA analysis to see whether the the classifications in the ABC rating differed in MPI score, and they differed significantly. So that was also a good insight for us, so that we will continue with the ABC rating. So for the next step, the starting point is there because the MPI is now coded in Python, and that will be used for future analysis as well. For example, if we look at, for example, our groups of participants have coaches, they differ in group sizes, and they perform differently. So I want to see if that has an influence on the eventual poverty levels. And also I want to look at what drives success. And if we look at that, we can also make adjustments in the weekly training. So maybe we give them more life skills or more entrepreneurial skills training, things like that. And in the end, now for my analysis, I looked at the MPI scores at the end line, and in the future, I can also look at the difference between baseline and end line, so that we look at improvements and not on absolute endpoint scores. Yeah, that was it. So if there are no questions.
Yeah, I think Irina says in the chat to welcome the next fellow, Muna Mamat.
Yeah, I'm just sharing my screen. Am I visible?
Yes, we can see it. Thank you, Yvonne, by the way, sorry.
I'm sorry, I'm just taking a bit time because my computer is not responding well. Well, thank you, everyone. I'm guessing that I'm the last participant here. So I'm Mune Mohammed Choudhury, of course, a fellow of the ABW Fellowship Cohort 3, and I'm working as Research Associate in Economic Division at Bangladesh Institute of Social Research Trust, which is a renowned research organization in Bangladesh. So my project title was Power of Women in Decision Making and Control over Resources in Climate-Prone Areas of Bangladesh. So before letting jump into my project, I will just let you know, in this project, I just impose my time on skilling me up on our coding skills with statistical analysis. So I try to cover as much as possible within our coding, not many kind of statistical analysis like regression analysis or principal component analysis. So yeah, it's just a beginning for me with R coding. So yeah, here is the primary objective that to assess ownership and control of women have over land resources and their influences that they have in decision making in financial or family-wise decisions, and their autonomy in matters taking like personal mobility, especially during natural disasters. So yeah, we have had a survey in the beginning of this year in the most climate prone areas of Bangladesh. So yeah, here you can see that the name of that locations: Bhola, Bandarban, Kurigram, Noakhali, Rajshahi, Rangamati, Satkhira, Sylhet. These are the most vulnerable and climate prone district of Bangladesh, and we cover all of them like flood prone, drought prone, salinity prone, even cyclone prone areas. So we can have a better understanding of what these people are actually going through. So this is a big kind of survey with 650 respondents, and over like 190 variables are there. So I just put a little bit part of that survey and try to skill it up my coding skills by introducing R. So here I used Excel and R. Obviously Excel for data cleaning and R for some descriptive analysis. So beginning with that, here are the gender distribution of our surveying participant that we have collected data from the overall percentage 32% and male are 68%. And the educational of that surveying the marginal communities are 40% of them didn't attend school. So yeah, you can see that how much marginal they are. So just they are living their own life with some sort of agricultural things, or depending on small things to do with like fishing or working in others' land. So yeah, you can see from that here. And there are some regional distribution, I'm sorry, that Muslims obviously constitute more of that percentage, and there are other religions like Christian, Hindus, and Muslims. Coming to the main part of our analysis, I just try to describe the descriptive analysis here because I'm new in the coding arena. So beginning with that session, that table 3, you can see that we have asked the respondents that do they have or their female family members have access over lands, and 46% of the survey respondents said that their female family members, or if they are female, the respondent are female, they say that they have no access over the land resources, which is very, very much alarming that they can't actually have that kind of land in their ownership. Going to the table 4, you can see that does any of the female household member own any land, or if you are a female, if you own a land, 97% of them portraying that they have no land in their own. So it actually represents a patriotic society, and within the marginalized climate prone community, women are more marginalized there. Coming to the table 5, you can see that our question was, do you, the female respondents, or a female household member have the right to make decisions about household expenses? 43% of them are say that they have no right to make any decisions at all. And coming to the 6, that they have the right to decide to go move out by their own, they have said negatively that they have no right to decide their moving capacity out of their house. So yeah, it's all mean that the women are even marginalized than in that climate prone area. And the last part of my analysis was that if they are not going to their parental house or not, 15% said that they cannot actually move from their house to their parental house without the consent of their male female members or their guardians, whomever it is. And coming to the last, I can say that the interesting one, the table portraying that if they have the right, I mean the female household members have the right to move to the nearest shelter center by their own during any natural disaster. They have said that 50% of them said that they have no right to move by their own. It means that they have to go with their male partners or their male guardians. So it is actually portraying that in that patriotic society, women can't make any decisions by their own, and it is urging that how much necessary is to actually gain women empowerment in that vulnerable climate prone society. So I have actually had a lot of idea about this project, but within the time constraint and as I'm new in the coding area, I can't actually make a lot of statistical analysis through that. So yeah, you can see that the analysis window from R, which I have actually gone through this phase. And here is the coding summary, which I have actually done for this small part of analysis here. And which is actually big for me.
Sorry, Munem, sorry to interrupt. We have to get back to the main session. I'm really sorry, but everybody's waiting in the main room. So if you could maybe spend 1 minute to finish up.
Just 1 minute, just 1 minute.
Okay.
So what will be the next step of mine? We are planning, actually, me and my team is planning to make a research paper on that, wherever there will be logistic regression, there will be correlations among the variable, and cross-sectional analysis, cross-tabulation analysis, where we can better understand the variable interaction and make a more judgment about women empowerment. So yeah, thank you everyone for this kind of opportunity to give me present my project. Yeah, thank you so much.
Okay, the challenges was that I have limited experience with Python and the high sensitivity of data because of the political issues and the war in Yemen. The solutions was learning Python libraries such as Pandas and NumPy, and I'm still learning till the moment, using anonymized data sets to ensure the data security. The programming languages was the Python for data automation and preparation. The tools and techniques, I use Excel for initial data handling and the Tableau for dashboard visualization. Python functions like pivot table, read Excel to Excel, cleaning, and NumPy, it was planned to choose NumPy for handling numerical arrays, but Pandas also can do it. This is the final project, the final dashboard, daily distribution dashboard. This is a fake numbers, but the project is to facilitate the cleaning and to preparation the database extracted from the HTS to the Tableau dashboard. Okay, the process work.
Hello?
We lost her again.
Oh dear.
I think her
Technology.
connection. Yeah.
Let's just wait for her to come back in. The next one afterwards is Flavio. Is Flavio in the meeting? No? Okay. Lima?
Lima already did her presentation, so she is not.
Oh, okay. Mariam?
Yes, I'll be here.
Okay, all right. Will you get ready to do yours then?
Yes,
After
sure.
Anfal? Yes, sure. Great, thank you.
Yes.
Let's just see whether Anfal comes back. Let's just give her another couple of moments. And I think I had also a question. Oh,
Hi again. I'm sorry, I don't know what's happening.
Shafi would like to be the next one to present. Shafi Lula. Is that correct?
Okay.
Okay, Anfal's back. First Anfal.
Do you hear me?
Yes. Yes, we all hear you. Yeah. Anfal, I think the time was also unfortunately also.
I Okay. This is. Can I complete or no?
Yes, please. Please do your closing remarks.
Okay. This is the code of the Python. The project focuses on improving operational efficiency. There's an echo. There's an echo device. Okay, and is there any question? I was planning to share the code. But there's no time. But this is how it works, anyway. Fini. Is there any questions?
Any questions, Fanfa? No? Okay, Anfal, thank you very much for your time and your energy and your great project.
Thank you. Sorry. Thank you.
It's very quick, isn't it? This couple of minutes presenting, and with all the technical issues in between,
We're
it's a little chaotic.
running.
Huh? Sorry?
Okay. We are running.
We are running, yeah. Okay, I had a message from, there was a message from Shafilullah that you would like to do your presentation first. Oh, we don't hear you. You're on mute. Is it possible to unmute?
I think I should proceed. Tessa, you are mute.
Oh, yes, Mariam, please proceed. Please proceed, and then Shafilullah can be the next one afterwards.
Can you see my screen?
Yes.
All right. So I'm Mariam Farzan from WFP UNHA's United Nations Humanitarian Air Service in Afghanistan, and I'm working in customer service as an aviation officer, and my work is to prepare reports, providing data, numbers, statistics, and also for that, I worked on preparing a dashboard where my objective is to have a centralized key performance indicators and to have the numbers, the data, the number of the passenger, for example, the cargo that we transfer within a month, within a week, within a year. So this dashboard will be able to filter all those data quickly just by clicking at a specific month, and then the data will be filtered for each specific month. Right now, we do not have such a centralized system. We have the information, the data for different months, and then we do not have proper information for filtering the number of female passengers, male passengers in our report, so we do it manually. By this dashboard, my aim is to have a very quick and efficient filtering process through this dashboard. And I have used the primary audience for my project is our management, our customer service team, and our operation staff. And the data type is numerical, and it has time series data. The source of my data is from, I have collected the data from our internal records, from the systems that we have, the software that we use, and also from customer logs and operational reports. And I have collected the data from long monthly insights on passengers and customer interactions. And also the data that I have presented, which is very important for our operation, is the total number of flights that we operate, and also the number of passengers that we served in domestic and international flight, also the number of male and female passengers, the cargo that we have transported, the type of the organization that we have served, and how many passengers we have transported from each category, and also the monthly trend for demand, for the flight demand and resources used. The approach that I've used is the data visualization, and I've used the Excel and Power BI potentially for filtering the data and the numbers. The challenges that I faced was collecting raw data from different sources and then filtering those data. That was a quite challenging thing, but by implementing data cleaning and processing, the process was easy, and also coordinating closely with the operational team to ensure the data is accurate. And the expected outcome from my project is a real-time KPI dashboard for customer service team that and also its impact will enhance our customer satisfaction, decision making, and also planning for the future of our flights and resources. And also the summary of this dashboard or my presentation is that the customer service support dashboard will be a valuable tool for ONHA's team, driving to better resource use and satisfaction of our customers and also management. If I am not out of time, I want to just show a demo of this dashboard that I've created. So this is
Go ahead. Wow.
I want to see the data, the number for the month of January. So if I click on Jan, it will also only filter the month of Jan. The same for February. For each month, if I want to filter the data, it can give me the information. And also I can have the total information of the all months, year, and the categories individually. So this is what I have prepared. That's all. Thank you.
That looks amazing. What a beautiful dashboard. Was the team happy with it?
Yes, very much.
Yeah, I can imagine. Any questions for Mariam?
I had a suggestion, just a suggestion. If you can use the standard colors of the UNHAS, it would be much better.
Perfect, I will.
Any other comments or questions? No? Okay, then we will move on swiftly to our next speaker. Sorry, yeah, is somebody wants to offer themselves? Somebody wants to say something? Oh, Shaflula. Okay, great. Are you unmuted? I can't hear you. I don't know whether anybody else can hear you.
Asmat Sevaga, the mute, the mute ne obasa.
We can hear you.
Already khwata chap lastara sada the mute ne obasa. Audio si likali da mute da mulajana.
He's not mute, but we can't hear anything.
I think he has some technical problem. He already put, I think it has the problem. What problem? Goshakani di ubasa, goshaki si waki di biane ore goshaki di mubasa. He want to present his project without, the sound.
That might be a little bit difficult.
Let's move forward for other fellows, then we will come back if the issue
Yes,
is
let's
solved.
do that. I think that's a good idea. All right, so the next I have on the list is Pallavi. I don't know whether I'm pronouncing that correctly.
Yeah, it's a correct pronunciation. I'm here only.
Okay, great. Do you have your presentation ready? Are you able to share?
I'll share, but I'll just let me know because Saifullah is also presenting the screen. My presentation is visible or not. Is it visible?
Yes. Yes.
Yes.
Cool. So
Okay.
hi everyone. Myself Pallavi and I'm from India. I have an experience of 8+ years in development sector. I have worked on women empowerment, skill development and health projects earlier. And as of now, I'm associated with the organization Quest Alliance, which is working in India and which believes only subject-related information is not enough. 21st century skills or employability skill is something that can help a youth to enter into the world of work and sustain for a longer time into the world of work. For that we are working, and I just thought to brief you about it because on that only I have the project. So my project was about analyzing the baseline and midline training data of employability skills, 21st century skills, and objective was to assess the effectiveness of the training program. So for that we have two kind of data. One is baseline data and second is midline data. So baseline data is something collected before the TOTs and the trainings, and the midline is something that we have collected after the training. So it was 2 days training. The idea was to do the data visualization and create a dashboard of the data so that everyone can see the progress of the training programs. So here is my progress in terms of data analysis process. So I was the part in step 1. I was the part of designing the survey for baseline and midline survey. Second was the data collection during the trainings. Third was the data cleaning. So the data I have received, it was so much complicated. It was in CSV file. So here I know only basics of Excel and the pivot table, not beyond anything else. So I tried Python. So I spent my more than 2 and 3 days in data cleaning to find out some of the ways to not do it in a manual way or filter way. So somehow I was able to learn the simple formulas. I tried Python and some other ways also, but I was able to go with the Excel formulas only. Then I explored dashboards. So first I tried Power BI. I spent my 2 and 3 days in Power BI. And then I thought it is so much complicated for me at beginner level. Then I went with the Google dashboard Looker Studio. And the next forward plan is I am going to present it with my team members. I'll be going to work on this more because the dashboard I have prepared, I feel it is the first draft only and it nearly needs lots of hard work. So I just shared my dashboard. So this is how the sheet used to look like this. So lots of blank column was there. So that's the reason I shared with you. It took 2 days for me to do the data cleaning. And this is how dashboard looks like. So in left-hand side, you can see it has cover page. One is overview of basic demography. So someone wants to just filter it in the basis of baseline and lines. So people can filter it on the basis of baseline and midline. They can filter it on the basis of state, district, and institute. So anyone from the team member can make the use of this and they can get the basic information of experience and the designation of the training programs, trainers related information. This is something from the baseline report. This also can get filtered as per the need, as per the state, whoever wants to filter it. So for example, we want to see the time sufficiency. So we will click on this so we can get the data. So this is how we can just get the data. So here is the midline report. And the last 2 pages are about the comparison of the midline and the baseline. So people can see the impact of this before baseline and after the midline. So this is what I have created.
Perfectly within a time, Pallavi. Thank you very much.
Yeah. If anyone has
I see a
questions.
slide with takeaways. I don't know whether you wanted to
Yeah, so,
highlight 1 or 2 things in those.
Yeah, so the basic, one of the takeaways was for the training program. So there was some pre-work we gave. People were not able to complete the pre-work. So that was something very important. We collected the consent for the baseline and endline. So some of the people clearly said they don't want to fill the form. So there is need to work through the organization to the participants, like they should talk to them and do the a kind of counseling to the people, like if they are filling the form, it is something private and all, that they will be having a mindset to fill the form. And personal takeaways, like it's very important to check before creating a dashboard who is going to use the dashboard and what is the outcome of the dashboard. So this is how we can make the proper justice with the data, because there is I mean you can play with the data and lots of things can happen with the data, but in which direction you want to present the data, it is also very important. These are my personal key takeaways from this.
Great, great. Any questions for Pallavi? Going once, going twice.
Amazing job. Amazing job. Thank you.
All right. Thank you very much, Pallavi, for your great work and your time and your thoughtful presentation. And then we go on to the next presentation, I think is Renata de Kok. Is that correct?
Yes. Okay. Let me check. Do I already share something?
No, you're not sharing anything yet. Yes. Now we see yours. We see. I will start the clock. Good luck.
Yes, thank you. Well, good afternoon, everyone. My name is Pramata de Kok, and I work at Longfonds. And today I'm presenting my project, Predicting Churn and Strengthening Relationships. So at Longfonds, we focus on building a sustainable community of engaged supporters. And the objective of this project was to identify the drivers of churn, so whether supporters disengage. And with that, develop strategies to foster long-term loyalty. By identifying these drivers, we aim to ensure ongoing support for initiatives that make a meaningful difference in patients' lives. So to achieve these objectives, I followed these 5 steps. I don't want to get too deep into it because it will take much time and we already have that little time, but I work with internal data for around 650K records, and a lot of the thing that was most time consuming was the data cleaning process. But the most interesting is, of course, the methodology and approach. So let me explain the specific methods I used. First of all, I created a heat map to visualize supporters based on engagement and donation value. So left on the bottom, you see the amount of people that have a low engagement score and do not really give any donations. And on the right top, you will see the people that give a lot of donations and are very engaged. But the most interesting is, of course, the churn prediction. So what I did was I applied a logistic regression, which is a classification model to predict churn likelihood. And my definition of churn is if someone hasn't been active for a year, so doesn't show any engagement with our organization, or does not give any donations with any for a year long, then that person is churned. So that's my target value. That's the thing that I want to predict. And predictor values are some demographic features, so like age, where a person lives, contactability, how can we reach that person, how long has someone been a supporter of Longfonds, does the person give any donations, how often, how much, and some engagement features like Does the person open any emails? Does he click on emails? So that's how we were trying to predict churn with those variables. And the last method that I used was a feature importance analysis to identify the most influential factor that drives churn. So the most interesting part, of course, are the results and the outcomes. So my churn model achieved a 94% accuracy and an AUC of 0.98, meaning it is reliably ranked churn risk. So it can predict for 94% accuracy if someone is going to churn or not. So it's quite a good model, if I can say myself. So the key drivers of churn were, first of all, emails received. So that means that high email frequency was strongly associated with churn. So this suggests that communication fatigue or overload might be driving disengagement. The second most important key feature was donations per year. So pure donations is linked to a higher churn rate. And the third important feature was engagement score. A lower overall engagement score causes higher churn, which speaks for itself. And feature sensibility, the model's accuracy decreased by 3% if the most important feature was removed, which shows its critical role. And a third finding was that variables like age and province, so more demographic variables, had minimal impact, which reinforces the importance of behavioral data for retention strategies. So there were some...
Hi, Pamata. Yeah, time is already passed, so please feel free to do some closing remarks.
Yes.
And then there'll be a little bit of time for questions.
Yeah, sure. So I think the most important thing are my key findings and learnings. It's important to have clear objectives upfront. Data preparation takes a lot of time, but it's very critical for a reliable model. So invest your time in that. It's important to get regular input from stakeholders and let the data speak for itself and do not force any results. So thank you for your attention.
Thank you, Pamata. Thanks a lot. Any questions or comments? Or, yeah. Pamata, thank you very much. I think in the chat, somebody already said, very easy on the eyes, beautiful presentation, very clear results. So thank you very much for your effort and the great project.
Guys.
Next on the list is Ritika. I've seen you in the meeting.
Yep, I can start. I'll just begin sharing my screen. Let me know if you all can see it. Can you see my screen?
I think it's coming up now. Yes, can see it. Go ahead.
Okay, awesome. Awesome. Okay, so I'll just start and I'll try to keep it very, very quick. So the way that I've broken down my presentation is first, I'll give some context on what I do at Rocket Learning, what our organization is about, because that's very critical to understanding why I picked up this particular project statement, and what I plan to do with it even in the future. So just a quick disclaimer that my project is not fully done yet. I have done some parts of the analysis, which I'll be presenting right now, and I hope to sort of finish this up in the next few months and topic that I picked for my project was essentially analyzing shared content pieces that we, as the organization Rocket Learning, share through our products and see what gaps there currently are, identify a plan of action for improving our impact. Let me go to the next slide. Yeah, so this is basically just some very quick context of what Rocket Learning does. Um, we are essentially operating in the space of early childhood education and care. And we believe that essentially at the very beginning of a child's life, there has to be good care, there has to be good education for the foundation to be really strong so that there can be successful outcomes later on in their life. And the way that we're doing it is by tapping into the existing daycare center in India. and doing it by capacitating parents, teachers, and the support system that a child has. And we're doing it through a very low tech solution using WhatsApp. So our parent engagement and teacher engagement happens through WhatsApp, and the capacity building also happens through bite-sized content pieces that we share with different frequencies with these different cohorts of caregivers for a child. So that's essentially our approach, and we're looking to sort of build a more equitable access to quality early childhood education for all kids, starting in India and hopefully scaling it up to the global south. So yeah, this is just a quick summary of what our products are about. There is one set of products meant for parents and one set of products meant for teachers who teach in the daycare centers. Yeah, this is just a quick snapshot. I'm not going to spend much time on it, but within 4 years, we've been able to expand to 10 states within India and covering around 2.5 million children. So now coming back to my project, I think the context was important to understand how exactly, I'm going to sort of perform on the project. So I mentioned 2 types of products, right? One is the WhatsApp-based solution for parents, and the other is the WhatsApp-based solution for teachers. So there are content pieces that go in every day to capacitate both these sets of parents, and there are different teams within my organization that send different type of content. And the project statement was around observing these different groups. So I selected groups from different geographies, observing what kind of content at what frequency goes in these different types of groups, and sort of seeing if that scheduling, if that frequency is really effective or not, and what kind of engagement are we getting by sharing that on the groups. So these are some of the questions that I'm trying to answer. I've answered some of them for the parent product already, and I'll be scaling that up for the teacher product as well. So what's the volume of the content shared every week? What's the format and media type? What's the timing of the content sharing? Because timing is also very important, because the parents that we're targeting are from low income communities. So they won't be active throughout the day on their devices. So there's like a particular time to catch them. Which is typically early mornings. And I wanted to see if our content is actually being shared at the right time or not. And then which are these teams that are creating and sending the different pieces of content? Is the weekday and weekend scheduling looking different? Is there any overlap in content scheduling or not? So I essentially did it in a two-pronged approach. One was manual. Yeah.
Ritika, sorry, the time is the 4 minutes are over, so please spend a little bit of time on your closing remarks, and then we have some time for questions. Thank you.
Sure, I'll do that. I'll just like take 30 seconds to just close the context of my project, and then I'll just go to concluding remarks. So yeah, essentially the data collection was through manual observations across these parent and teacher groups across different geographies. And this is exactly what the raw data kind of looked like. And I did all of my analysis on Excel and Google Sheets. So yeah, this is just like some snapshots from the dashboard that I've built in Excel itself, and I'll quickly just, sort of show you what kind of data analysis I've done. I'm not spending too much time here, but I wanted to see what it's looking like on weekdays and weekends, which team is posting what kind of content, whether it's a nudge, a poll, a video, and so on. This is kind of like a day-wise split. And here I've deep dived into one of the geographies that I mentioned in the previous slides. This is basically the timing and overlaps, right? So in terms of what my next steps are, I have finished the analysis across a few geographies for the parent product. So I want to finish this analysis across the 2 products and across the different geographies that we operate in. I want to draw on some insights that I've already sort of built on, and I want to share that with all the teams that are there in Rocket Learning with the leadership team. And then we want to identify actionable insights to improve this data dissemination process. And just to give some context, because I missed it at the beginning, I'm the chief of staff at Rocket Learning, which means that my role is also a very collaborative role, and I work with different teams. So I'm kind of really well placed to carry out a project like this and share insights with the leadership team so that we can develop an actionable plan like this. Yeah, open to any questions.
Ritika, that's amazing, and there's never enough time, so apologies for that. Any questions for Ritika or compliments or comments? No? All right. Thank you, Ritika, for your time, and good luck with implementing it further. I see Shafiullah. Are you have you managed to? Is the speaker working?
His speaker is not working. يودك يا شفيلة. He just called me and want to connect from here. So he called me and I will just keep the his sound here and you may hear from here. You can present now.
Okay. Because can we do a short inventory of how many more speakers we have? Because we have Estefani, who also needs to present. Are there any other people who also need to present? Could you speak?
Quickly present my presentation. Unfortunately, I have a problem with my microphone. The presentation is about passenger, how many passengers we transported in 2043. This is the purpose to indicate with one of the presentation about the passengers we transported in 2043.
Abdul, I'm not sure whether this is working.
Okay.
I can't hear the things that are being said. I don't know whether anybody else can hear it properly. No, I think we're finding.
He join? I would suggest something. If he can join
Yes,
from
please.
the phone, and we can present for him. We can open the presentation for him, and he can join the Zoom from the phone, like a call phone, like a phone call.
Yeah. Abdul, maybe you can discuss with him whether he can join from the phone, and then we can present for him. In the meantime, I suggest that we go to Estefani. And how many other people still need to present? I see people that I didn't have on my list. I see a Luke and Eva. Do you also still need to present?
I think they are guests. I think.
Oh, they are guests? Okay, good. All right, so I suggest to move to Estefani first.
Yeah, I'm gonna present now. Can I present this? Me, Dylan, yeah. So, good afternoon with everyone. My name is Stephanie Sikla. I am working as a data analyst and data advisor at Acting. Acting is a consultancy that works to help social organizations to learn from data. And my project that I choose for the fellowship is creating a social map that social observatory for Hengelo municipality. So a little bit of background about this is this project started with the necessity of mapping all the social organizations in Hengelo. And at the beginning, this was done manually with the team in Hengelo municipality. But the challenge was to convert this in an automatic way of mapping that information and get the insights of social needs and problematics of the neighborhood. So the goal for me was to create a tool that compares services and activities available in the neighborhood and the social needs of the residents. For who was this? It is done for the municipalities, for welfare organizations, for neighborhood teams, and this is an aid in decision making to identify gaps in service delivery and support the data-driven approach. How was this done? Well, as you can see, the social indicators of the neighborhoods are really open data available. I have used the health indicators from the Central Bureau for Statistics here in the Netherlands, and the other part of the information that was over the services that were available in the neighborhood was done through a search in Google Maps. with Google API to get information of takers, gym, clubs, but there were a kind of organizations that I need more information over. And that was, for example, social organizations, NGOs that offer bingo, but offer to some kind of support groups. So they have a range of different services that help the people in their neighborhoods, and I wanted to map that information too. For that, I use a beautiful tool that helped me to go to the web and make a web scraping, and then to parse the information, I used a large language model. In this case, I use Geometry, that is an open source model. So with that, I could finally get a nice data set that then I plot in a map and in a web map, actually, using Folium and Streamlit. How does this work? Well, we have two layers, actually. The first layer is our the activities. You can select the themas, subthemas, the left side, the time, the ages. And the second layer is about the social indicators, and it's plotted as a choropleth. So we can see, perhaps I'm gonna share that part. Yeah. So can you see this? This is the web map I have created. Here you can select a specific neighborhood. You can see it? You can see it. Yeah, you can see it. And for example, here I have selected body science for mental support. And as a variable that show the problematic, I have shown the enzyme height, which means loneliness. So you can see in the map that the places where are more, the feeling of loneliness is bigger, have less activities that are regarding mental support. So this is a nice insight for the people that work in the municipality to try to make new projects, fill up the gaps, so they can perhaps make something that really help to improve this indicator. And as this can be, for the future, this can be done for the whole Netherlands. So this is now alone for Hengelo. But the team, my work, there is a huge team working to improve this and make it more scalable, and to see and to let the people from the policymakers to have a better insights and work with data. That's it.
Wow, that was already written in the chats, but yeah, it was great. Thank you very much, Estefany. Are there any questions? Any observations? Any questions? Okay.
The presentation was cute and heavy at the same time. I don't know how. Yes.
What he presented in this project is by Mr. Shafiullah. He is also working as a finance assistant and WFP has Kabul. So the project he chosen is about the cost recovery report, how to reduce this cost recovery. Like we have two sources of fund, or the budget that we can cover our operation. First is we are receiving the fund from the donor, and another is from the agents. Like when we are serving our customers, so in return they are paying some amount, like 25% of the cost recovery is paid by the customer, and 75% more is from our donors. Scroll up. Chirtalade. Scroll up. He just finished the project, you know. Rasa Dwamta. Bas. So he also used all the pivot tables and all the techniques in Excel, and based on the organizational internal policy for communication information, he summarized the report for the presentation, and this report will cover the transportation of all international and national passengers transported by the ONHAS. As I said, I have also used those data, but the purpose of mine was to how to reduce the errors we have within the 2022 and 2023. So we have two types of passengers, the national and international. Scroll down, Mulajana. And these are the data that we have from Jan to December. We call it ADF, the Air Development Fee Cost of ONHAS domestic and international flights for 2023. So these are the cost we are paying to the government. So he used he want to share this with the government in order to reduce these costs and use it for the operational costs. Like how much we are paying to the government is around 46,000 in a month. So for a year, it will be approximately 127 or 174 in 2023. And all the invoices we have received, the MOTA means Ministry of Transportation and Aviation. Scroll down, Mulajana. So these are the trends he want to show for us, and years wise and monthly wise. Zanur Amlandi. Again, he want to show all the figures for international and domestic flights and the pie chart that how it works and what are the data or the funds we are giving to the government, and we are UN agencies. If it's possible, he want to share this with the management and our stakeholder, which is the government, and want to reduce these costs and want to put this amount of cost in our operation instead of giving this to the government. Zabia Landi. So these, if you have any question, you can ask from Mr. Shafirullah, not me.
Great. I'm so glad we managed to run through
I hope I could
his
convey his
presentation
message
and the
to
sheet.
you all. Sorry.
Absolutely. Any questions on this presentation?
I hope I could answer. Yeah. His
right.
whole project was how to reduce the amount of cost recovery we are paying to the government. So we want this to be spent in the operation instead of giving it to the government of Afghanistan.
Okay, clear. Sounds like a good constructive project.
Yeah, thank you. Thank you
No
so
other
much.
questions? Estefany, did you have?
Can just do. All right. So yeah, I will just start again. So this presentation is about making a reusable code for a drought forecast scale analysis. My name is Amy, and I work at the Red Cross, specifically in the data and digital team called 510. This is the agenda for today. I will share with you why I wanted to create a reusable code and go highly over. I will go over the steps just on a high conceptual level to execute these steps. And the goal of this presentation is to share some simple and effective techniques that I learned during this course with you, so you can also enhance your coding in the way I did in the last couple of weeks. Just a short introduction. So I work in my day-to-day job, I work a lot with early action protocols, which are protocols that describe actions that aim to reduce the humanitarian impacts of forecasted hazards. These early action protocols are based on a climate service, which basically is a forecast of a specific type of weather event, for example. And we do a lot of research to improve these climate services, and part of my job was to do an analysis on if there is like freely available remote sensing data available on the internet that we could use potentially in such climate services. And that's what I call a drought forecast skill analysis. So I compare a lot of different drought forecasts among each other. So what I wanted to do is to get the data from using an API. I want to apply data transformations, for example, using Python pandas. And I wanted to compare the forecasted versus the observed drought events that came out in a confusion matrix. And I would use the skill indicators to show the quality, the comparison for that. And I was quite confident because I have like a data science background. I had quite some time to work on it. And it actually provided a good basis to create a reusable code, because it was also expected that this analysis would be useful for activities we do in the future. So that became my personal goal to write the code in a reusable way, to apply it anywhere on Earth with any data available and run it from every PC. Those were basically my 3 personal goals to it. So first, in the project itself, before this course started, I finished the project, got the deliverables, and then I used the time in this course to making the code reusable. However, you might have noticed that in your own work as well. I had quite, I got all the deliverables, but my code was quite a mess. I had like a lot of different cells that I used in my Jupyter notebook. There was a lot of noise in my code, some exploratory code that I wrote. And yeah, it was quite difficult to transfer this to a colleague effectively. After the project ended, I even found it a bit challenging to understand the code that I wrote a long time back. So for Analytics for a Better World, I tried to create a reusable, easy to execute code. And I wanted to challenge my software skills a little bit and get out of the comfort zone of the Jupyter notebook, but actually use Python files. It was interesting to learn that. So together with my mentor, we installed version control in GitHub. So I created a GitHub repository. I tried to make some visuals to explain the steps over, but you can find them back later if you want to do this for yourself. So I linked it to Visual Studio Code, and I made an initial commit to it, so I could always go back to the previous versions that I wrote. And I created a new environment for it using it. And then I started actually really like getting through the code, got rid of all the unnecessary lines of code, simplified the definitions, and provided good and understandable comments with it. And I extracted the variables out of the code in a config file, which I sorted the variables in 3 categories: country configurations, standard configurations, and the paths to my files. And now the idea is that my colleagues only adjust these files in order to reuse the code. And I also wrote an API to get the data. Then using the package subprocess, I used this to combine all the data, the files that I wrote. So it could be packed together in a so-called executable, which basically is this main file that you see here in the image. And this is a file that I can now share with my colleagues. Even if they don't even have Python on their computer, they can run this executable, and then they will run my analysis code using the variables that were stated in the configuration file. So it's quite an easy way now to share the code and to run it. I'm going a little bit fast over all these steps, but as I only have 5 minutes, I want to end with some conclusions and discussions and some takeaway points. So my goals were to apply the same analysis for any country. That went well because I used the configuration file and I extracted the variables. Also, I wanted to apply it to any data available. Now I found that it took a lot of time to write the API, and there needs to be an API for each data source out on the internet. So I only took one related to the climate data store of ECMWF. And then run it from any PC. That was made possible using this executable. So I was quite happy in the end. And then maybe the major discussion point. So this was quite a maybe alternative way to write the code. Still, I think this is interesting for large pieces of code, but for simple analysis, actually, like the analysis that I also did, Jupyter notebooks can also be made reusable and easy to work with. So I think this would still be my go-to way of working when having a sort of smaller analysis. On the last slide, I wrote some takeaways, but they are more like for you if you want to do this work in this way as well, to make your code in this way as well. So I'd like to thank you for listening, and I'm looking forward to the next presentations. Back to you, Parvati.
Thanks a lot, Amy. It is really interesting work because it's also relevant, I think, to many of the data science projects, not just at Red Cross. I will now open for questions. We can take 1 or 2 questions if you have any. No questions from the other fellows? Mahmoud, over to you.
Okay, thank you. Let me share my screen first. Hello, everyone. I'm Mahmoud Eren. I'm a workforce data analyst at World Food Program. First, I'd like to thank the ABW team for this fellowship program and my supervisor for providing me the opportunity to participate in. For my final project, I developed CountryLens. It's a chatbot designed to significantly enhance my team's efficiency. While it is not a ready-to-use solution yet, it will serve as a proof of concept that can help secure buy-in from management to allocate additional resources toward further development of this tool. First, I'd like to introduce the environment where this tool provides a solution. My team focuses on strategic workforce planning and organization alignment exercises for function areas and country offices within WFP. And this project specifically targets country offices and their organization alignment exercises. When an organization alignment exercise begins, the team must review numerous documents to understand the context of the country office and its individual functional areas. And this requires significant time and effort to read and analyze a large volume of information. And the idea behind CountryLens tool is to save the team substantial time during this preparation phase. Large language models, abbreviated as LLMs, are incredibly powerful tools, but they excel primarily at general knowledge tasks. I have used retrieval augmented generation method. Also, this is referred as RAG in short, to connect LLM directly to the knowledge base I prepared from the publicly available country office documents and with some fake workforce metric data just to test. This is a method which enables LLMs to access the most up-to-date and domain-specific information without requiring extensive and expensive fine-tuning methods. I also want to highlight that if you share your internal organization documents with proprietary tools, there is a risk of exposing your confidential data. To address this concern, this project exclusively uses WFP country office data that is already in public domain. There are several open source tools and frameworks available for implementing a RAG solution. In this project, Gradio is used as the web-based chatbot interface, and LangChain framework enables seamless integration of various tools and components in the architecture, and also it allows easy replacement of these components with alternative solutions. FAIS is utilized as the vector database, and OpenAI's GPT-4o Mini serves as the LLM engine. I collaborated with a colleague who conducts organizational alignment processes to craft the most relevant questions for the chatbot based on the data we provide to the chatbot. And we asked some ad hoc questions to the chatbot to test it. The chatbot delivered successful answers in most of the cases. For example, when asked about the strategy duration, it typically provided accurate responses. However, there was a specific case where the documents contain conflicting data. The chatbot gave incorrect answers. For example, a country office annual report mentioned the strategy duration as 2017 to 2022, but another document, which is a strategic document for the same country office, the strategy seems to be starting from 2023 to 2027. Additionally, the chatbot successfully outlined the country context for the country in question. In this example, you see the answer for Pakistan. Another test focused on the workforce metrics of a country office. As I mentioned, I provided a document in the knowledge base containing randomly generated workforce metrics data for various country offices. The chatbot successfully retrieved the relevant data for the specific country office in question. There are challenges to address and future work required before this chatbot can be effectively used in our organizational alignment exercises in a production environment. The first challenge is establishing a secure environment for handling confidential documents within the knowledge base, because ensuring data confidentiality is critical for us. And automating the data feed into the model is another key area to focus on, because we have various data sources involved, and this requires a careful planning. And testing the chatbot's accuracy will also require additional effort to evaluate its performance consistently. And finally, the model sometimes generates answers from its general knowledge base rather than relying solely on the provided knowledge base. It is also essential to enforce the use of the knowledge base to ensure the latest and most relevant data is delivered to the user. And that concludes my presentation. Thank you very much.
Thank you so much, Mahmoud. This is excellent work. And I really like the evaluation that you have done, because that is something that many of the Gen AI experiments fail to do, have robust human-in-the-loop evaluation metrics. So I really like that you have played around with that. Questions for Mahmoud? No questions?
Maybe I have a question.
Go ahead, Amy.
Yeah, so Mahmoud, I was wondering if you, when you were using or like trying out a little bit the LLM already, what did you think of? Because sometimes LLMs they're known to make a bit of strange sentences, so to say. What do you think of the quality of the one you used?
Yeah, I think it's. I was mostly happy with the responses, but of course there are some strange ones, and I also get some responses like "I don't know," because the prompt was telling the LLM if the data is not provided in the knowledge base, please do not say something. Just say "I don't know." And in some cases, I also get this answer, but I also discussed this with my friend who provided the questions to me. She was also happy with the answers mostly.
Oh, that's great. It's interesting that you prompted it to say, I don't know. Maybe that's also something that can be used elsewhere to avoid this strange answer sometimes, because it just, I don't know. Okay, interesting. Thank you.
Thank you.
Thanks a lot, Mahmoud. We next have Mohammed Tarad. Mohammed, over to you.
Sure. Yes, definitely. Thank you. I'm just sharing my screen. Hi, everyone, and thank you for giving me the chance to present on my project. Of course, thank you for the BAW team also for the great opportunity that we have in the previous months so far, I would say. Shortly, since I have 5 minutes, my project basically is around the creating a small-scale early warning system prototype, which is specifically assigned for humanitarian response in conflict-related emergency. So the project, basically, the rationale behind this project was most of the humanitarian organization, they face like the timely response to the emergency is often delayed because there is no specific like detection mechanisms that can result sometimes, in late or slow, I would say, decision making when it comes to these specific conflicts, and also it might be also resulting in insufficient resources allocation and delay in the assistance provided to the population. So the rationale behind that is basically providing a small type prototype of mechanism that could allow the organization to decide when an emergency situation, specifically in conflict related to the conflict, happened, that can give an early warning alert that enable the organization to allocate resources and provide responses as much as fast as it could be. The objective basically of this one is if my project is basically just to help the organization respond quickly, and the scope was just to make sure that I don't go like for the bigger size of the prototype. So the scope was only focusing on the emergency conflict related emergencies within the one region, which is the Middle East. The prototype was developed by using Power BI platform, developing interactive dashboard to make sure that it's allow every stakeholders who've been involved in the consultation to use it as like to their potential, as I would say. Two main area of open source data have been used within this system, basically from the armed conflict location event data, which is called ACLED, and the other one from the humanitarian data exchange. So those are the main source of data, which is our open source. That data are basically updated either weekly or daily basis. Those are basically used to feed in that the dashboard that has been developed for this project. There are specific certain indicator that's been decided through the consultation with several stakeholders in my organization. Thank you. So yeah, basically there is specific indicators that has been decided through the consultation to focus on while developing this prototype. Some indicators are relevant to the conflict events, specifically around the number of conflicts, civilians targeting, number of fatalities, tracking event frequency by location, specific location also provided through the maps. On the other side as well, some specific indicator related to the displacement, such as number of displacement, event case displacement trend by location, and of course average monthly displacement happened in each separate location that caused by those armed conflict or like conflict situations. The system basically, specifically within the dashboard, it has three main pages, which each page basically focusing on specific indicators. The first one is basically focusing, as mentioned, on the visualization of conflict-related indicators that include event count, civilians targeting, and fatalities. User can, of course, through this page easily monitor and track the conflict event by specific location, whether like at admin level 1, admin 2, or 3, and at some point it could go as like village or like communities or camps even. The visual also display the event, like the type of event. It could be like at some point explosion or battles or like cross monthly, quarterly, or on yearly basis. That all possible through the system. Filters, of course, within the system as well, like allow user to view the incident by country and location. And there are two specific visuals that assign to be give an like automatic alert when they are basically cross the threshold being pre-identified. The second page basically focusing on the risk level, which is like the risk level is basically being calculated and analyzed based on the data that has been collected or collected through the open source. So the average source, for example, of the conflict happened in certain location, it was calculated based on the average. The risk level it was assigned whether like between the range as low and medium and high. It always like through this risk level, once it's reached its for example, like a green or yellow, that's like the range was assigned as color coded. Any red or like yellow color reach to the level which is like assigned as average baseline, then an automatic alert will goes to all stakeholders being assigned within the system. So all they will receive some notification system either through their emails or either through Teams chat group that it's being created for this system, which is will give them an alert to take an immediate action. So they will be able to look on the system and identify what is the alert coming from what location, what is the incident, what is the conflict, and then they will be able to take the action or response that basically meet the needs. The best thing that it was also being able to create within the system is the forecast. I was able to collect several amount of data, which was not I think it was a lot, which was also challenging at some point, like just to ensure like several data being downloaded from several pages that are like from Relief, Wave, or from Anab, or from different like open website, are consolidated and standardized in a way that it could fit within the dashboard. It was challenging, but eventually it was basically possible to do through the analysis. And then we were able to create some forecasting over like for the upcoming 3 years between 25 to 27. The forecast is not necessarily like specific or accurate, but it's built on the baseline that has been identified in terms of each conflict, the number of conflict happen in each location. So it might be like not reasonable or realistic at some point, but it could give some indication whether like some specific location will face a specific amount of conflict in upcoming year or months. Now the one page also is been basically assigned specifically for the displacement event, which is like some indicator including average of displacement and daily and monthly, quarterly basis also, along with event cost of these displacement that are possible also to manage and track and keep monitoring whether they are and some certain location, because it could go beyond the threshold it's being calculated. As you can see here, there is like some specific low and medium and high level. Those basically, again, it's being calculated based on the average baseline. It's being discussed with the stakeholders within the organization to assign in each location what it would be the baseline for like to identify a low threshold or medium threshold or high threshold. So those being agreed, once those are agreed, it has been transferred basically to the dashboard to give some indication whether the incident or like displacement, will be significant. So that means the alert would be sent again to the stakeholders, or it could be like a low, then no action will be taken through the system. One thing also to mention around the system, basically, it's as a small prototype. It's built on two main specific open data source. However, we thought it could be enhanced to enhance its functionality. We could add additional data such as data from around the urgent needs and gap in humanitarian response. Unfortunately, I couldn't have the time to add those because it's like the amount of data, it's not that manageable. And there is a lot of data that available out there that could be used. But this is some of the improvement that we are thinking on to take forward from within that system currently. Also, we thought around providing more comprehensive overview of linking the conflict with the displacement, and then also adding the needs of those displaced people or like displaced vulnerable populations. The other thing that we thought also around the improvement of the system is basically the system focused now currently only on the Middle East. We thought also like bringing more data, it could be expand its scope where it can focus, for example, for Africa region or Asia region as well. Eventually, it could also add some indicators that related to natural crisis, not only conflicts such as like flood, earthquake, wildfire, and other things. That it also definitely can be added to improve better the system that currently developed. And lastly is basically the data update require manual effort at the moment, because like it has been used from several, I would say, source. So there is potential to link the dashboard directly with the online source. So that means the data will be updated automatically, specifically the data that updated on daily basis, such as the displacement data. That's something we need to think about, and we discovered that some sources basically are paid source, which means we need to provide some paid subscription. So that will be, there will be some cost will be involved there. So we are thinking that if we can provide secure some fund, then we of course can do some subscription specifically for those open source and closed source information, data of information. Then we can make sure it will make the entire process much more easier, and will save a lot of time and effort from the team. Because to be honest, I was not able only to with like myself manage all the data that I was working on, but also I was working with the internal stakeholders within the organization, specifically the emergency team that we have. So we could at some point like analyze and like integrate and consolidate the entire data we got all together in one system. Um, um, yeah, I think that's three main improvement that we currently think that we will take forward from here. But at the moment, I think the dashboard is really practical tool. It's easy and simple, and each stakeholders, whether they are within the emergency team or out of the emergency team, such as like communication team, or like finance team, or like HR team, sometimes they will definitely be able to understand what's happening within the system and what does mean an early warning system will look like when they will look at the dashboard, and when they will start reading its visuals, as it's said in a very simple and friendly manner. So yeah, I think sorry, maybe I took more time than that assigned to me, but that's in a very short. It took more than that, but I'm conscious about the time, so that's it so far. And thank you for listening, and happy to receive any question from you. Sorry.
Thanks a lot, Mohammed. Since you took a bit more time, I would skip the questions just to make sure we stick to the time. But if you have any questions for Mohammed, please feel free to add to the chat so that he can respond to you. I am not sure I know exactly how to pronounce your first name. Goga Alexis. I'm really sorry if I butchered your name, but please let me know how I pronounce it. But it's your turn now.
Well, thank you. You are right. I'm Goga Alexis. I'm based in Kigali, Rwanda, at Carnegie Mellon University campus in Kigali, Rwanda. And I'm doing as a research assistant and also as a graduate student in engineering artificial intelligence. I hope you can see my screen.
I can, but yeah, perfect. It's loading.
Oh,
yeah, please go ahead. Thanks.
Okay, well, in these few weeks, I was currently going through this research of urban heat island analysis for climate resilient smart city planning. You know, as climate change is one of the most pressing challenge, and the idea in this research was how can we inform urban planners and policymakers by analyzing temperature change through satellite imagery data. And the mission and objectives of this study was to take the temperature and try to analyze urban heat island effect, and secondary to understand drivers of urban heat island effect, and finally to provide the insight about the city planning with minimal urban heat island effect. Moving further, urban heat effect. This is an effect that occurs where the city or urban area experience high temperature compared to the rural area surrounding them. Well, to continue through this, I have used Landsat satellite data. I used Landsat 8 and Landsat 9. For the proof of this study, I compared two regions. One is Kigali and the second one is Western Province region, which is not urban compared to Kigali. As you can see, this data was taken from satellites and I analyzed them using Python, Geospatial Data Analytics, and Google Earth Engine. And you can see from these analytics, the temperature data in Kigali is pretty high compared to these little areas. And I have also took another step to analyze the global temperature, to analyze it because this is the global concern, but the most focus was on Kigali, but this is the analysis that I have worked on global temperature data set that I took from Cargo and try to highlight the most 10 countries with the highest temperature. And moving forward with regard to this study, the idea was to analyze and identify the heat vulnerabilities as I have demonstrated it in previous slide, and to help implement city-specific solution and try to help in building climate resilience economy by achieving low carbon and sustainable growth. And the future of this work and the skills that I have developed involves geospatial analytics and remote sensing, data analytics, and analyzing imagery data from satellites. And the future work is to compare the temperature data from satellite with meteorological data because there might be some difference in satellite data and meteorological data, and to compare this satellite data with socioeconomic development data and the integration with urban trends using Maxwell urbanization data. This study make it worthy to continue further analyze it, as it has proven that Rwanda has experienced a temperature increase of 1.4 degrees Celsius since 1970. Thank you. This was the work I was going through, and the supervisor was Walter. I think he's here, and we plan to continue working on this. Thank you, and this is the time of Q&A.
Thank you so much, Ngoga. This is really nice work and very relevant because satellite imagery data sets have a lot of potential to be used in different applications, including in climate change screening, resilience, adaptation, etc. So really good work. Questions for Ngoga? No questions? Okay, in that case, let's go with the next fellow, who is Florence Ovino. Florence, over to you.
Thank you. I'm just going to share my screen. Okay, so my project was discussing about methane emissions, specifically in Kenya. And I went ahead and discussed the sources, the major contributors of the methane emission. And just for your information, it's that the methane emission is more potent compared to all other greenhouse gases. So also I wanted to relate this to our economy. And now I went ahead and find out the contributors to the GDP of Kenya. So in both, we'll realize that we have agriculture being contributors to both. And therefore, I got interested in seeing if there is any relationship that exists between the gas emission and the Kenya's GDP, because we have agriculture for their contributors both. So from my results, it's true that there is a relationship, but this still, we can't say that there is like one causes another one. So from my results, you can see a little bit of hypothesis testing. So my case study was methane emission in Kenya has been seen to always increase year in, year out. And therefore, with this increase, there is always a worsening of greenhouse effect, threats to wild animals, disruption of weather patterns, and also increase air pollution. So all this is related to our climate. And therefore, I wanted to get into ways in which we can reduce or mitigate the emissions. So from the sources that I read, it's that more plans are there, but one that has already started be done or in pipelines, like all the plans that are there still in pipeline, I didn't find tangible results, and therefore I went ahead and investigate if there is an already plan or a practiced way that is already working, if it is not even in my country and in others. And gladly I found one, and that is from Ugwe, that is already being done. And therefore, the whole thing about this project was to see how methane emission relates to or affects our economy. And at the same time, we wanted to find out the ways in how it can be reduced. And therefore, we get into predicting future values for the methane emission from the data that we got publicly, and also attach it to the hypothesis testing that I've just presented in the previous slides. And therefore, the one that we got that has already, that is at least it's already being done, we saw it wise to work with a strategy that is already being done, and the results are being seen. And this is one project. So I was checking out how this can be done in Kenya, and therefore we actually come up with many assumptions for it to work, because there are many differences that exist between Kenya and Uruguay that is already practicing the project for mitigation of methane. So we have some assumptions here lined out, therefore. This will be well understood when you read about the project, how they are doing it. And therefore, these are some of the assumptions that we made, so that if these assumptions are true, then what is happening in Uruguay can also be successful in Kenya. And therefore, results can be obtained that is in reducing methane. So this is just a graphic of prediction of results that we have. This is just from the data that we have, how methane emission has always been, and the future values if nothing is done. That is, there is no ways that is adopted to reduce the mitigations. So we can see from the graph that future values show that the methane emission will always increase. So if we take into consideration the project that is already being done, and now put it into our data and see what effect can it have, we find out that it is being done per hectare. Like the quantified methane emission from Uruguay was done, they were quantified per hectare, which is really different from data set that I got from online that I was using for the prediction for Kenya emissions, because those were just giving me total emissions that we have for a whole year. So I came up with some small calculations to see how all that will be. So it is true that if the project is adopted in Kenya, there will be a positive results, with the assumptions not forgetting, that will help in reducing the the methane emissions. So also these our projects will see that methane itself, the major cause is from livestock farming, that is specifically from Kenya. And therefore, if the project is adopted, we'll see that it will help, especially in the livestock and agriculture sectors, to drive efficiency in food production. Also, Kenya has climatic goals for supporting economic growth, so this will come in handy. And also the project that I was mentioning, that I find out that there are those that are still in pipeline not being done right now. So at least we are coming in with a strategy that is already being done to facilitate this reduction. And so now that we found at least a strategy that is already being practiced, and with the assumption that this is adopted, and therefore there will always be a reduction in methane emission, there will be an interest of getting kind of a model that the one that I came up with for predicting future values for methane emission, just based on if there is nothing that was being done, but now at least we have a way that can be adopted. But now we have to think of a way of coming up with this model that will properly help us to predict these future values of the emission strategically, because as I mentioned earlier, this project works with like a section of land. It's not everything, and therefore the model should be able to predict this. This is a continuation from what we had, and also in my organization we have a branch that just deals with methane emission, but for their job is just to like collect data about methane emission, but using satellite. So I was coming in with this project to help in now step ahead. After data collection, we can predict future values from what we have, and also if mitigations strategies are also in place. Hopefully, if this works, it will also help us to always find out what methane emission will be having time by time. And yeah, so this is what I've been working on. I'm very grateful to my mentor, Alex. He came in handy. Thank you.
Thank you so much, Florence. This actually sounds like a very interesting project, and I'm glad to hear it also aligns with the work that UNEP is doing. Since we are a bit short on time, I will skip again the Q&A, but please do paste any questions you have for the fellows in the chat. With this, we'll go to Yori, because Tawanda is not able to present today as he has some connectivity issues, but he have already shared his slides with us and a recording, and you can see this recording in GitHub and in YouTube when it's ready. So over to you, Yori. Yes.
So it's now on full screen. Hopefully it's all seen. So hello, my name is Juri Suikerbuik. I'm working for Cohort, and thank you for having me. I'm here. I would also like to praise my mentor, Mikhail Sadia-Matov, who was a great help during this project. So I will go through a project which is called the AGRIP program. This program is a project for 30 million in Uganda, and it runs in 16 regions in Uganda, in 196 sub-counties. And the objective of this program is more or less twofold. In one way, we want to increase the land right ownerships for farmers by issuing certificates in the next couple of 5 years. And also we want to increase the delivery of governmental services, which is sometimes a problem related to in Uganda. And we do this through to improve the inclusivity, the quality of the local government. And also we would like to increase the budget availability for local governments, because this is often a problem, is that there's not enough money available to within these local governments to do all their activities. And we're using result-based financing, which is a methodology often used in the development context. It's kind of a pay for performance. So if certain kind of activities are met, then incentive is being paid to these local governments. So when, let's say, when there's good governments in place, then certain kind of bonuses are being paid to these local governments, to these sub-counties, and to these regions. So for this specific project, we wanted to create a Python script which creates these invoices. So these are, let's say, these bonuses for these sub-districts. So these 196 sub-districts, which contain the results of all the hard work they've done. And also the RBF payments, the result-based financing payments. Also, we want to create a dashboard for to monitor the progress of the program and also the outcome of the program, mostly for internal use. So, of course, this is a big project in multiple regions of the country, and we need to know that all the data is in place. We need to know what is the increase of good governance in these regions. And also we want to create a kind of a database for further analysis. Me and my mentor, we worked on a script. I will go now to my GitHub environment. Like Emily, we created a GitHub environment, and we created a code. Here you find the code. Now let's say there's a full let's say an automation with a push of a button. Let me just run the script. With the push of the button, all these invoices are being created for all these. Here you see the 3 different kind of departments. Here you see different kind of sub counties. And you find all the invoices that are being created for these local government. Let me just show you one of these invoices. So this is for the administration department of Busaga in the Kamuli district. And let me just show you how such an invoice looks like. So these are, let's say, these performance payments that are being conducted. So based on their results, like these governments is related to coordination meeting, but also about certain kind of funds are being forwarded, or the CCO, so the actual land reform were being submitted to the people. Then a certain kind of when certain kind of targets are met, then the bonuses are being forwarded. Secondly, I was mentioning we also so every time we run the script, more lines are being added to the database, in which we can track the actual outcome of the project. So in Power BI, we created a dashboard. So here in the dashboard, you can see the actual submissions of all the. I have to mention this before. But we've, let's say, all the data is being collected through Comcare, which is a surveying tool, so a digital surveying tool, in which we collect all the data from the different local governments, or let's say from community feedback, or receive information from sub-counties. And here you find, let's say, here you find all the number of submissions that are being entered. And here we have a page specifically focusing on the community feedback. So how do they perceive the project? Do they see already some changes in the project? And also some results. Well, of course, we have now 1/4 of the project. So every quarter of the year, new data is being entered through enumerators in Comcare. We now have only 1/4, but yeah, here you find here you find, for instance, results of let me show you, of one of the departments. So let me just go to for instance, DPM department. So here you find an invoice that is being created for Q4 of department DPM, and the number of amount of monies that being received by this department. And over time, of course, we can track, based on all these indicators, we can track the actual outcome of the project, and also what kind of progress there has been made on good governance in these districts in Uganda. Yeah, I think let me just go back to the slides. So that's the outcome of the script, and that's the outcome of the dashboard. I think that's it for now. I think maybe the next steps I wanted to mention. The next step for now is we're thinking about, let's say, I'll also automatically send all these invoices to the different kind of sub-counties. So these are 196 sub-counties. That's one. Also, we were thinking about maybe, like Amy, also creating an API to retrieve all this information from our, let's say, our data source, and let's say automatically run every quarter. And we know that this process normally took around, let's say, 2 weeks to and of course the data collection, but also getting the invoices ready and then send it to. But now this is just a push of a button, so this is a real time saver, especially from let's say, from our project side. So that's it from my side.
Thank you so much, Yori. It looks like a lot of work have been put in the limited time you have had as part of the fellowship. Amazing. Please post your questions for Yori also in the chat, and we will now go to Daniel. Daniel, over to you.
Hello, everybody. Can you hear me?
Yes, and we can see your screen as well.
Okay. Now, my name is Daniel. I'm excited to share my final project. Now, first, we'll start with a brief introduction to the organization I work with. It's MWF Health Africa. It's an NGO focused on lasting change. We use education and innovation for lasting change. We reach millions of people. For example, in 2023, we helped more than 6 million people. Key components are innovations and educations throughout our international universities and services like flying doctors. The objective of my plan is to help MWF with their fundraising campaigns, then make them more effective. And the challenge is to reduce cost and increase revenue by selecting the right donors. Instead of mailing the entire group, we select the ones that most respond, that will reduce cost and increase and maintain revenue. I used the SQL Server to select the 3 data sets, a training set, a campaign for the training set. I used the campaign from 2022, where I trained the model. A test set. For the test set, I used the campaign from 2024 to test the model. And a scoring set, I selected the current donors to predict the response. And these data sets are cleaned and prepared for analysis to ensure accuracy and consistency. I used Google Colab and Python to build the model. The process I use is as following. for data exploration, data distribution, and to understand the data and issues like oversampling. For oversampling, I balanced the response and non-response class. I built the model in a random forest. I used hyperparameter tuning to enhance performance and accuracy further, and I tested the model. To understand the data better, I visualized the data with a decision tree. The tree works by splitting the data in smaller groups. And each groups make the model more accurately. For instance, the donors with the age above 50, or they paid frequently. The model predicts them higher for the response. And my my final recommendation is to only select the top 69% promising donors. It will save more than 194,000 euros a year. This is the calculation. The total group size multiplying by the response rates will calculate the estimated expected responses. The costs are calculated by the cost per mailing by the group size, and the revenue is calculated by the average revenue per donor multiplied by the expected donors, expected response. Now, my learnings were to work with Python, also work with oversampled data sets, and also to visualize complex data sets to understand the data better. Also work with together with multiple tools like Microsoft SQL Server, Colab, Python, to create the results. And I want to thank Floor, my mentor, and Eliette, my manager, for the guidance. And I hope that will give you an idea how response models can generate more revenue for NGOs like Emmer. I don't know if there are any other questions.
Any questions for Daniel? But it looks really great, Daniel, and the impact that it can have. And I think this kind of analytics is relevant for all the nonprofits because fundraising and donor analytics, we have also seen in the previous fellowship some similar projects, and we know that it is very, very relevant for multiple nonprofits. So thanks. I hope all the other fellows also learn from this experience, and hope you can share the slides, of course, in GitHub.
Good afternoon once again. Before to introduce and present my project, let me to have a short introduction from my side. This is Lema Alizai, and I joined the WFP since 2021. Actually, I'm working as an aviation assistant. Also have a strong background working with the humanitarian organization like United Nations, some USAID project. Today, I'm really honored for that to present my presentation as a final project of this fellowship program. The project which I have selected to present in this fellowship, and I work on that, is a customer service key operational indicator reports. Actually, this project was not initiated before within our organization. It's the first time that I initiated this project within our organization in order to monitor the performance of our operation, also to make the better decision for the future of our organization performance and bring improvement. What I did in this project, actually, I gathered the information, I collect the information from across the department of our organization, which are the finance team, the booking, cargo, aircraft operation, the safety and security department. This was the 5 departments which I collected the key indicators and the trend in order to make the project and present our organization performance in order to make the better decision. This was the objective of my this project. The audience which I considered for this project was actually the department, the heads of department, the stakeholder, also the management of our organization. The data which I used in this project was the type of numerical data, the categorical data, and the time series data. The numerical data was from the finance team, from the cargo. The categorical was from the safety and security, because they need to provide us with the issue that they have been faced, how many issue has been closed, how many issue they have open, on how many issue are serious. The time series data was from the booking train, also from the flight operation, because we need to provide the number of the passenger transported, the flight how many flight was operated. These are the trains that I used in this project as a time series data. As I mentioned before, the data has been collected from these 5 departments of our organization, like finance, booking, cargo operation, and safety and security. The methodology that I used in this project was actually the collection of data from the relevant department across our organization. Also, by preparing and creating the integrated table of the key performance indicators. The tools which has been used in this project is from Excel. I used Excel software to represent my data and information. I prepared the trend analysis, the key indicators table with analyzing the data through the charts and tables. It's clear that during the preparing the project, it's not easy to complete the project. Yes, for sure, I faced with many challenges. The main challenge for me was the data accuracy. It was the main challenge for me. Also, the delay in receiving the data from departments. That was the 2 big challenges which I faced with, but I prepared the solution for these challenges. What I did regular communication with the departments in order to provide me with the accurate data and provide me the data on time. I set the clear deadline for each department. Also, in order to ensure the accuracy, I did the primary review of each trends I received from each departments. What I'm expecting from this project, what I was expected from this project is to prepare and create a comprehensive Excel report with providing the data visualization of the key indicators. This is the outcome I expected from this project. Also, the impact on our organization, what will be the impact on our organization, is to give me a deep understanding of our organization performance in order to take the better decision in the future, and also to provide the feedback based on our performance, and monitoring and tracking the performance of each departments in organization. That was all from my side. That was all information from the project which I have worked on that. Thank you from your attention. That was all. Thank you.
Thank you so much, Lima, for the comprehensive presentation. I have a few questions. So you said that this is the first time in your organization such an exercise is being done. Have you discussed these results with other stakeholders in the organization, and what was the feedback you received? And is there interest to continue working on such analytics? Thanks.
Thank you. The information, yes. Before to start working in this project, we discuss with our organization management and also information which we are receiving from our stakeholders, like the information regarding the funds we are receiving from them, regarding the aircraft that they are providing us with it. We already discussed this all information through our management team. So based on their agreement, we received the information from the stakeholders. Then we prepared this project in order to evaluate and monitor the performance of our operation.
Good day, everyone. I'm Tawanda from Zimbabwe, and I'll be presenting on my project within REACH, mapping the way to accessible water. But unfortunately, I'll be rushing this presentation because I'm not in a very good connectivity area, so I have to rush it while I still have connectivity. So I will not possibly go over the presentation because it is there on GitHub. I'll probably just run to the results and explain them briefly. So the motivation for this project was to analyze water access coverage around boreholes and quantify populations served and provide actionable insights for improving WASH services, and assess population coverage around boreholes to identify functional gaps and then improve access based on those insights. So according to the latest report from Zimbabwe Livelihoods Assessment Committee, ZIMLAC, only 50% of rural households in Zimbabwe have access to safe water, less than 500 meters from home, which is a WASH standard, where water should be accessible within 500 meters of a settlement. So because of the El Nino-induced drought, nearly 4% of boreholes in rural Zimbabwe have dried up, particularly in Matebeleni South and Masvingo provinces. So the situation is worsened, with 6,000 boreholes breaking down as of August 2024. And these are some of the values that I got from running the script and analyzing the data. I used a population density raster and also a water point data exchange dataset, which has a couple of geocoordinates for water points across the whole world, but I focused only on Zimbabwe and only on boreholes. So these are some of the recommendations. I'll also not go through them. You can read them in the presentation, which is on GitHub, then the conclusion as well. So I'll just rush to the visuals, some of the visuals I got as results from running the script. So on the left, top left, we have identified boreholes which serve no one within a 500-meter buffer, and then on the right we have boreholes which serve more than 500 people within a 500-meter buffer. So according to sphere standards and WASH standards, a borehole should not serve more than 500 people. So this is a good insight to have, to know which ones are overburdened in terms of the populations they serve, and also which ones are not being useful. And then below we have a population raster showing the population within 500 meters, total population within 500 meters of functional borehole. And then on the right we have the entire raster of the population density, just for comparison. Then here I ran the script to analyze different population coverages based on different buffer sizes. So you can see from 500 meters to 1 kilometer into 5 kilometers, the changes are drastic, from 4% to 10% and then 34%. So it's a good insight also to have, which will help us analyze what could be the reason and how we can close that gap and have most of our population within that 500-meter buffer. I'll just try to switch to my the actual Jupyter notebook. I'll also not try to run it now because I'll post it in the GitHub so that you all can also run it, also include the data sets. So apologies for rushing this through, but you can also change some of the parameters to get different calculations that you may need. So thank you for the time.
Good afternoon, everyone, and thank you for joining me today. Let me walk you through my project, the expenditure analysis. The main goal of this project is to have an efficient way to monitor and track expenditures with a special focus on outlier. Our primary objective is twofold. First, to group regions with similar budgetary and expenditure characteristics, and second, to detect anomalies within each group that could indicate unusual financial behavior. To achieve this, we use a combination of machine learning algorithms. We start with the feature selection, then we have the data preparation, where we enter missing value and we generate custom variable. Then we have dimension reduction, the clustering methods that allow us to segment regions based on patterns in their data, and anomaly detection models that flag regions that deviate from their cluster norms. A diverse selection of features has to be ensured to avoid skewed clustering result. Key feature categories include economic indicators like GDP per capita or public expenditure, demographic and social data, and more. This approach provides a well-rounded view of each region's financial and social landscape, useful for a better clustering. Before clustering, features are normalized to uniform scales, and after that, based on number of features collected, we can conduct a correlation analysis to remove redundant feature. And additionally, we can use principal component analysis, or PCA, to reduce the feature set while retaining significant variance. I choose k-means for clustering and for its scalability, and using the elbow method we can find the optimal number of clusters, and each cluster represents a group of regions with similar budget management style. After clustering, we applied anomaly detection model within each cluster. Models like isolation forest, local outlier factor, and one class SVM were used. And the goal was to identify a region within each group that deviated significantly from their cluster behavior. And we flagged anomalies that were detected by at least two methods during the examination. And by investigating this outlier, we can uncover valuable insight and try to understand the underlying cause of budget deviation. In conclusion, combining clustering and anomaly detection could provide a richer understanding of regional budget management. And moving forward, refining the model with more features and applying it to a larger dataset can further enhance its accuracy and applicability. Thanks to all.
Any questions? If not, we are actually completed. I know that Gideon is not able to hear us. I checked, but I think he is not. But otherwise, I must say it's really amazing to see the progress you have made. And we have heard all the way from dashboarding and Power BI to data analytics, to prediction models, to chatbots. It has been such a wonderful diversity of projects. And I really, really hope that we get to work and continue collaborating with at least some of you. We will probably reach out to you. And if you have ideas to work with Analytics for a Better World, please reach out to us as well. With this, we will move back to the main room and take a short break because the other team, I think, since we are all in different time zones, let me tell you exactly how many minutes. So we will have a break for 10 minutes, give or take, and then we can resume the session. But please in the main group, we would like to hear at least from some fellows what your experience have been in this process, also based on what you heard right now on the presentations. And like I said, really looking forward to continue collaborating with all of you. It has been an amazing journey for me. Got to learn a lot. So we'll now go to the main room and take a short break of 10 minutes. Thanks. So it was really exciting for me to listen to all the presentations, at least in my breakout rooms. There were fellows building Power BI dashboards. We had prediction models. We had chatbots, and we even had like some very cool guidelines on how best to make reusable code, which is, I think, applicable across all data science projects that I have come across so far. So it was very exciting for me to see all this being accomplished in such a short period of time. And I am really looking forward to also seeing what happened in the other breakout rooms. I'll probably binge watch this in the weekend just to see what other exciting work have been done. I think with this, we can wrap up also the feedback sessions. I want to thank all the fellows for sharing about your project. Also, I see in GitHub all the details of the projects are already uploaded. So really looking forward. And now we have Professor Dick Denhatog, who is Science to Impact Co-Director at Analytics for Better World. He will make some closing remarks, and I really, really hope we continue working and collaborating. Over to you, Professor Dick.
Thank you very much, Parvati. So, so this fellowship is in fact the most important item of ABW. So indeed, I am the Science to Impact Director of ABW, but we consider this this fellowship as the most important activity that we do. And so besides this fellowship, we also develop and apply analytics and also develop new analytics techniques to contribute to the Sustainable Development Goals, to NGOs. We do a lot of impressive and nice projects there, but this fellowship is even more important. And so hearing your stories, I think it was again impressive. And I would like to congratulate you with successfully finishing this fellowship. It is impressive what you were able to do already after this short program. And I really hope that we stay in touch also in the future. And for example, if you need help with more advanced analytics problems or projects, then we are there at ABW to help you. So again, congratulations with what you have done. And I would also like to thank the mentors for their help. I think that was really fantastic. So many thanks. Okay, so I hand it over to you, Parvati.
Thanks a lot, Stick. As you can see and hear, this is actually one of the most impactful things that ABW does. And it's all thanks to, of course, the fellows for joining and choosing this program, but also all the organizations that support us by providing trainers, because as you can see, they are all like people who are working actively, and they give us their time to give one-on-one mentoring, irrespective of the time zones, like what we heard from some of the fellows, and totally dedicated to the mission. So we are very, very grateful for all the organizations for their support, and all the mentors who have individually given attention to these projects. In addition, I also want to thank all the organizations that you are part of, because this year we specifically asked that the organization provide support so that the fellow can join. We needed a supporting letter from the company before we let the fellows join. So I really want to thank all the organizations and nonprofits who offer such educational experiences to be part of this. With this, we will close, and we are a few minutes late, but we had blocked your calendar for really more time, so that's good. But I would like to close by saying, let's stay connected, because we do projects, we offer such training programs. And Robert mentioned a bit about the accelerator program. I will, of course, we'll send you all your certificates within 2 weeks. You will also see all the lectures which are publicly available in our YouTube. I am posting also the YouTube channel here. We have our LinkedIn, our Slack will stay open. We will also reach out to all of you to see if there are any opportunities to continue collaborating. And I really wish all of you the best. And I also hope that all of you will stay connected to our other fellows as well. Thanks.